Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB.
Good morning, ladies and gentlemen, and welcome to the 6th Pakistan Pharma Summit. Please, we would like to invite you to come into the main room and take
Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB.
Good morning, ladies and gentlemen. If I could please request you all now to take your seats. Thank you so much. So we could get this morning's event underway. Ladies and gentlemen, can I please request you to take your seats so we can get this morning's event underway. Thank you so much. And just before we begin today, we've got an important note because the Honourable Prime Minister Mian Mohammed Shahbaz Sharif will be in attendance this afternoon. Volunteers will be coming around to take all your details with your NIC numbers, and can we request that after lunch you will need to have your original NIC cards with you. So please make sure you have those with you this morning and throughout the day. Thank you so much. Good morning to our dignitaries, special invited guests, ladies and gentlemen. Before we begin, I would like to invite our following esteemed guests to please come up and take their seats on stage. Saeed Farouk Bukhari, Chairman of PPMA, if you'd like to come up on stage, please. If we could also have Mr. Nadeem Zafar, Senior Vice Chairman, PPMA, Dr. Kasa Wahid, Chairman, Conference of Committee, Mr. Haroon Qasim, Co-Chair, Conference Committee, Mr. Asad Shuja-ur-Rahman, Co-Chair Conference Committee, and Mr. Hamid Raza, Co-Chair Conference Committee. Gentlemen, if you'd like to come up and take your seats on the stage, that would be great. Thank you so much. Pleasure to have you here today. And another one of our chief guests, Mr. Navid Khamar, will be arriving a little bit later on, as will Mr. Zubair Motiwala, CEO of Trade Development Authority of Pakistan. Like I said, it's fantastic to be here with you. My name is Emma Brain, and I'm honored to be your host for the 6th Pakistan Pharma Summit, hosted by the Pakistan Pharmaceutical Manufacturers Association. We look forward to a wonderful day ahead of insightful talks and panel sessions, as well as recognizing some amazing people in this room. But to begin with, we would like to have a recitation from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الرحمن علم القرآن خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان والأرض وضعها للأنام فيها فاكهة والنخل ذات الأكمام والحب ذو العصف والريحان فبأي آلاء ربكما تكذبان خلق الإنسان من صلصال كالفخار وخلق الجان من مارج من نار فبأي آلاء ربكما تكذبان رب المشرقين ورب المغربين فبأي آلاء ربكما تكذبان مرج البحرين يلتقيان بينهما برزخ لا يبغيان فبأي آلاء ربكما تكذبان يخرج منهما اللؤلؤ والمرجان فبأي آلاء ربكما تكذبان.
Wonderful. And next we're going to have a recitation of Nat Sharif by Tukir Al-Haq.
حقیقت میں وہ لطف زندگی پایا نہیں کرتے جو یاد مصطفیٰ سے دل کو بہلایا نہیں کرتے. یہ ہے دربار آقا کا یہاں ملتا ہے بے مانگے. یہ ہے دربار آقا کا یہاں ملتا ہے بے مانگے. ارے ناداں ارے ناداں یہاں دامن کو پھیلایا نہیں کرتے. زباں پر شکوائے رنجو علم لایا نہیں کرتے. زباں پر شکوائے رنجو علم لایا نہیں کرتے. نبی کے نام لیوا غم سے گھبرایا نہیں کرتے. یہ ہے دربار محمد کا یہاں اپنوں کا کیا کہنا. یہ ہے دربار محمد کا یہاں اپنوں کا کیا کہنا. یہاں سے ہاتھ خالی غیر بھی جایا نہیں کرتے. حقیقت میں وہ لطف زندگی پایا نہیں کرتے جو یاد مصطفیٰ سے دل کو بہلایا نہیں کرتے.
That was wonderful. Thank you so much. And now, before we get everything underway, ladies and gentlemen, please could we be upstanding for the national anthem?
Shah.
to begin our proceedings this morning, I'd like to welcome up Central Chairman at PPMA, Syed Farouk Bukhari, to deliver the opening remarks.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, good morning, ladies and gentlemen, dignitaries, diplomats, and your excellencies, and of course my colleagues and the position holders of PPMA. First of all, thank you for all joining us in this event. This is our sixth PESA event, Pakistan Pharmaceutical Export Summit Awards, which actually allows us to showcase what our industry is capable for export purposes. And of course, we recognize our highest people who have performed very well in the preceding years. And moreover, actually it allows us to allow policymakers and stakeholders to sit together to devise or to brainstorm a cohesive policy that will allow us more to export, which is the need of the hour at the moment. And I would congratulate the chairman of PESA Awards, Dr. Kaisar Waheed, co-chairman Harun Qasim Saab, Asad Shuja Saab and Hamid Raza for organizing such a good event. And I wish them success, and hopefully this event reaches the purpose what is set out to be. Thank you.
Thank you so much, Saeed. And up next to give our conference introduction, I'd like to invite the chairman at Pakistan Pharma Summit and managing director of MediSure Laboratories, Dr. Kaisar Waheed.
Assalamu alaikum and a very good morning. Welcome you all, and thank you for sparing time to join the August gathering of today. We have friends from abroad, and we are pleasure and honored that they have come to Pakistan to attend this very important program. I'm thankful to Dr. Emily from USP. She is coming from Washington to join this, and she's a keynote speaker as well. Dignitaries, excellencies, media, and our friends of industry. As our chairman, Mr. Farouk Bukhari, has already mentioned, that this is the sixth event in the last 10 years. We have started various programs on technical issues, and about 2 years back, we thought that when government of Pakistan is asking that export should be our vision, we should increase Pakistan exports, then we thought that why not we make pharma industry as a export platform for finished pharmaceutical products to various countries. To recognize the effort of Pakistan pharma industry who are exporting their finished pharmaceutical to various countries, we thought that we should recognize by awarding them with Pharma Award. So that was the first award about 2 years back, and today is the second award. I hope that the leadership will come after me to organize this kind of event, when take the cradle and beaten to new heights to organize these kind of programs. There is a concern among our friends in the industry why PPMA should organize these kind of event. Everywhere in the world, all trade bodies do these kind of event to make sure that people understand the industry concerns, the industry issues, their achievements, their honors. PPMA for last 10 years been trying to increase its visibility among the corridor of power. I could still remember 2 decades back, our visibility was not there. We were not recognized by any member or resident of power corridor. And now, yesterday we met 4 high-powered personalities of government of Pakistan. They welcome us. That is the visibility. We could ask, we could inform that what are concern of pharma industry, how they can help and facilitate industry to grow, to provide cost-effective, safe medicine to population of Pakistan and abroad. That is our vision. And now we can express ourselves. The visibility has given us this power, this thing that we can now, whenever we want to meet the high-profile personalities of Pakistan. And today, this effort of ours, of PPMA, Pakistan Pharmaceutical Manufacturer Association, and the leadership of PPMA, has done a criminal job that the Prime Minister, Honorable Prime Minister of Pakistan, will grace the occasion today, inshallah. That's the visibility. Our colleague in the industry must understand this, that their generous, I would say, contribution by Hilton, by ATCO, by Shazu, AGP, OPS, CCL, and many more, who have generously contributed today even PPMA does not have funds to organize gigantic kind of an event. But those, our friends, have contributed to this event. We could organize this program of today. And the benefit of this program, or program like this, will be reaped by the industry in days to come, inshallah. I'm thankful to the supporter of this program, PPMA Central Executive Committee, the leadership of PPMA, the media, the organizer Terabis, media partner Publicity Channel, and all other supporters who have come forward to help us to organize this event successfully. I'm thankful to you all, the audience, who have spared their valuable time to join us on this program. Thank you all.
Thank you so much, Dr. Wahid. What a fantastic introduction to the conference. And it is amazing to have you all here today to share your thoughts, your insights, your concerns, and your success stories. And we're looking forward to hearing them all throughout the day. Up next, what is the current state of Pakistan's pharma industry and its export potential? Well, we're going to find out from Group Managing Director and CEO of Martin Dow Group, Javed Ghulam Mohammed.
यार मैं उर्दू में रिक्वेस्ट कर रहा हूँ, भाई जागो भाई, चाय पियो नहीं, अगर ओए भाई क्या कर रहे हो, तुम जज्बाती क्यों हो रहे हो? जज्बाती तो हमें होना चाहिए जिन्होंने प्रोग्राम करना है। यार थोड़ा सा दोस्त आ रहे हैं, थोड़ा आप क्लैप करें, थोड़ा हमें जगाएं यार, ये कोई बात थोड़ी है।
Assalamu alaikum and good morning to everyone. Before the presentation is ready, I just like to say thanks to the organizing committee of Pharma Summit here, Harun Qasim Saab, Kaisar Saab, Asad Saab, Bukhari Saab, Ahmed Saab, and everybody here for organizing this event, and really like to welcome all of you who are participating here. So my presentation today will cover two parts. The first one is more about the challenges that the pharmaceutical industry is currently facing and the opportunities that we have. And the second part will be focusing on the export potential. Actually, the main purpose of this summit is to focus on export. I have to move here. Something. कुछ तो चाहिए होगा हाँ आज ही चलो आज ही all right thank you very much so we are going to talk about the current state of Pakistan's pharmaceutical industry and export potential here. Going to cover the global pharma market, the evolution of Pakistan pharmaceutical market, the spending by the government on the healthcare here, Pakistan and some comparison with the regional markets that we have, the current challenges, the export potential, and then followed by the global expansion strategy. If you look at the global market, the global pharmaceutical market is approximately $1.48 trillion, and it is growing at the rate of 5%. And if you look at the trend of the global market for the last 10 years, so we will witness that it is growing in the range of same 4 to 5%. And from 2019 till 2027, along with the forecast that we have, the cumulative average growth rate of the pharmaceutical global market will be somewhere around 5.4%. Now, this is the regional divide of the global pharmaceutical market. You all have a lot of experience of working with the pharmaceutical industry. If you look at this kind of chart 10 years ago, we'll see the major market was dominated by the North America, followed by Europe, and then Japanese market. But now this trend is changing. If you look at the forecast of 2027 now, the North America is going to contribute around 43% of the total market, and the growth rate is coming at around 5%. Whereas rest of the world, where Pakistan falls under the rest of the world, this market has now 25% and is growing at 7.7%. And the second biggest growth that you can see is in Brazil, Russia, and India, which is one of the blocs that is very popular these days and is one of the fastest growing economy of the world now. So it's growing at the rate of 9.3%. So although the major market is still being dominated by North America, but considering the growth rate, if you look at the next 10 years, this shift will change, and the rest of the world and the growing economies like Brazil, Russia, and India, and hopefully Pakistan will also contribute to the global pharmaceutical industry. Now we look at the pharmaceutical market of Pakistan. On an average, we are growing around 12 to 14% in Pak rupees. So which is a very healthy growth, because if you look at the world market, it's growing at the rate of 5%. But if you look at the local pharmaceutical market, it's almost like double, more than double of the world global market. But in terms of US dollar, it was $3 billion in 2019. And if you look at 2023 now, we are still at $3.1 billion. So there has been no growth in terms of dollars because of the major devaluation our currency is facing. So our contribution to the global pharmaceutical industry is not changing. Around 2019, the global pharmaceutical market was in the range of around $1.1 to $1.2 trillion. Our market share was same, which was $3 billion. And the market has moved to $1.5 trillion, but we still are $3 billion. So because of the major devaluation, Pakistan pharmaceutical industry is not really contributing significantly to the world global market. Then this is a little bit analysis, if you can see, comparing Pakistan with some same kind of markets like Bangladesh, Philippines, and Indonesia. The Pakistan market is 3.1, Bangladesh is $3 billion, Philippines is $4.2 billion with a population of just 100 million people. Indonesia is $10 billion. Total number of pharma companies operating in Pakistan is 650. In Bangladesh, there are only 270 pharmaceutical companies. In Philippines is 400 and Indonesia is 240. The population of Pakistan is 231 million, but I'm sure it's much more than that. And the Bangladesh is 170, Philippines is 114, and Indonesia is 274. So average market share per company, if we see, Pakistan is 4.7 as compared to all other markets, and per capita pharmaceutical market size of Pakistan is only $13.5. As compared, Bangladesh is now much better than us, which is 17.6, and Philippines and Indonesia is far ahead. So considering the population base that we have, the market share should have been much bigger. But unfortunately, our market is still very small. And what are the two main reasons that we can see is that one is the accessibility of the medicine is very limited in Pakistan. There has not been much spending by the government on the healthcare. Second is the pricing in Pakistan is one of the lowest in the world. So maybe in terms of volume, we are better. But in terms of pricing, if you look at the per capita pharmaceutical market, we are one of the lowest in the world. I think if we compare it with few African countries, they may be lower than us. Otherwise, if you look at the regional market, our situation is very, very low. And when we talk about the healthcare expenditure as a percentage of GDP, in Pakistan we started in 2016, it was 0.7% of the GDP, and now it's somewhere around 1.1% of the GDP. And we compare it with the regional countries here. We have Bangladesh, we have India, we have Indonesia, Malaysia, and Philippines. So Pakistan is 1.1% of GDP, Bangladesh is 2.63%, India is 2.96%, Indonesia is 3.41, Malaysia 4.12, Philippines is 5.6, and Singapore is 6%. So we have one of the, lowest spending of the percent of GDP on the health sector. So this is one of the reasons that why the pharmaceutical market is not flourishing in Pakistan, because the support that we expect coming from the government is not there. And you have witnessed, or you all have witnessed everything that recently we have seen a lot of changes in the health sector here. The major hospitals has been taken care by NGOs now. So if you see the way the Indus Hospital is flourishing, we can see the SIUT is coming up. So this is the job of the government, but it has been taken over by the NGOs. So we really don't see that a seriousness of the government is coming towards this sector. It's not only pharmaceutical, because health sector covers a lot of things. It includes hospitals, includes diagnostics, includes so many other things. But we cannot see any real focus or progress in this area. And if you look at the regional comparison, what we have done is that healthcare expenditure is one of the lowest in the region, is 38.16 is Pakistan. And if you look at the Philippines, is 193, Malaysia is 418. So there is really no comparison. We really don't have the focus on the healthcare sector in this country. What are the challenges that we are facing? We all have been witnessing, we have been reading the newspapers, is all covered in the media, and the PPMA level and the Pharma Bureau level, we have been making a lot of noise level, is that the inflation in this country is almost like 30%. I was looking at the top 50 economies of the world in Bloomberg, and you see the Pakistan inflation is one of the highest among the top 50 economies. Only we can compare it with Turkey and Egypt, which are in the same range of inflation, but Pakistan has one of the highest among the top 50 economies of the world in terms of inflation. The interest rate, we all know, is 23% now, Kaibor is, and we have been hearing that it will go to around 25%. And if you look at the spread which the commercial banks are charging, which is 1.5 to 2%, the effective interest rate in this country for working capital financing or to do any kind of investment is somewhere around 25%. So if you're putting any investment in the country, your ROI should at least be 50% so that you can cover up your financial charges, your debt servicing. And it is very difficult to have an ROI of 50% on any project, by the way. Then rising energy cost, we all know about it. Devaluation of Pak rupees is more than 60% from January 2022. It was 285 and from 176 to a US dollar. So 60% devaluation. And we know that pharmaceutical industry is heavily dependent on imported active pharmaceutical ingredients, packaging materials, and excipients are all imported. So there has been a significant increase in cost because of this massive devaluation. And we really don't know where this devaluation is going to end. Every time there is a news coming, some agencies are giving a projection that this will go to 350, 325. So as a pharmaceutical industry, as a businessman, it's very difficult to do any kind of planning or projection in this country that what will happen in 24 and 25. Whether we should be committing any major capital expenditure or not, we are not sure about it. Then there is another super tax that has been imposed because the people who are already paying taxes, they have been asked to pay more taxes now. Instead of putting taxes on real estate, agriculture, and traders, the government is doing is that putting more and more taxes on the existing taxpayers. So there is another term which is called super tax that we need to pay. So overall tax incidence for a pharmaceutical industry or by any industry is more than 40%, and by any standard is one of the highest in the world. And then inconsistent tax policies, the refund status, withdrawal of sales tax. Previously sales tax was 0.88, now 1% sales tax on API and 1% sales tax on sales that we need to do that. And after all these factors, the price adjustment that we have received after a lot of efforts of Pharma Bureau and PPMA, all the members sitting here, we got hardly 14% for essential drugs and 20% for non-essential drugs. And this 14% and 20% is also inclusive of annual price adjustment of 2023, which was 7% and 10% has been incorporated in this. So the incremental increase is we have received only 7% and 10%. And by any standard, considering these cost factors, is not being able enough to cover the cost that we have witnessing right now. And plus, there are a lot of hardship cases. Now, what are hardship cases? Because if you look at the formula, the products which are either doing a break-even or incurring losses will qualify for the hardship cases. And when we submit the hardship cases, they compare it with the regional markets. So you have to be the lowest among the regional countries, and you have to make sure that you are incurring losses. That's why you qualify in the hardship cases. And you trust me, there are more than 500 outstanding hardship cases with the DRAP right now. So you can understand that 500 molecules are either at loss or doing hardly break even. So this is the kind of a situation that industry is currently facing. Now, as a result, what is happening? So this is a very interesting analysis. I want everybody to really focus on this. But this is companies A, B, C, and D. These are the real companies that we have picked from the stock exchange. Due to some reason, we cannot really take the name of those companies, although the information which is here is in the public domain and everybody can access that. And this comprises of both multinational and local companies. So if you look at 2022, the company A, Q1, earning per share was 2.9 rupees per share. In 2023, it went down to 1.35, which is a reduction of 53%. Company B, reduction of 115% in earning per share. Company C, 70% reduction. And company D is now in losses. It used to be 22.76 per share earning, as now 37.03 loss per share, which is a reduction of 266%. So if you have this kind of cost increase, this kind of inflation, this kind of devaluation, and your price adjustment is hardly 14%, this is the result that we are facing right now. So I am only talking about the companies which are listed on the stock exchange, but I am sure this is a story for every pharmaceutical company sitting here. Now, look what is happening here. If you look at India and Bangladesh, so this is a comparison on the left side, which is India and then Bangladesh here. There are 3 companies from there, and this is also a real data. And their earning per share is increasing, 4.6%, 26%, and 108% in India, whereas in Bangladesh, 10%, minus 2.43 and 6%. And we say that Bangladesh, as India, has so many US FDA approved and MHRA approved plants. Yes, they can, because they can invest. They are making profits, they can retain profit, and they can reinvest. When you are making losses, you cannot really do the investment or upgradation of your plant and machinery. US FDA approved plants, how many have in India? 665. MHRA is 170. In Bangladesh is 5 and 6. Regional companies have made substantial advancement, and we are still struggling to survive at a local level. Now, what is the proposed solution we have? Because we have been talking about the problem here. Now, first of all, we need to deregulate our pricing apart from few essential items which are already mentioned in the WHO list, whereas all the other products must be deregulated, and it should be based on the market dynamics and the demand and supply basis. Their prices should not be controlled or governed by the government. Second one is there has to be an investment benefit for upgradation of pharmaceutical plants and quality systems. Because if you want to export your products to the regulated markets of the world, you really have to upgrade your plant, machinery, quality systems. And this investment is in the range of around 2 to 3 billion rupees easily. And we need to have some kind of investment benefit, some kind of funding plans coming from the government. Because if you pay 25% interest rate and you do all this kind of investment, then really you don't have enough room to do the big investment here. Then the quick resolution of the pending hardship cases. We need to classify pharmaceutical goods as a 0 rated versus current scenario of 1% tax. 1% central research fund, which is 1% of the pre-tax profit that we contribute to the government, and we really don't know what is happening to that central research fund, should be given to the industry, should be waived off, and we should be investing on the R&D. Then sales tax, a super tax, as the current tax incidence is already very high, must be abolished. And the final one, I'm going to talk a little bit about the export here. I'm sure there are many other speakers are talking about export. In export that we have 2 areas, one is product and second is services. Because we always been talking about the export of pharmaceutical product, we never focus on the pharmaceutical services, which also has a great potential for export. Now, we talk about the markets here. You all have seen this presentation. The rest of the world, Brazil, China, Europe. So there is a big market outside Pakistan. We are only sitting at 3 billion, and if we keep focusing on this segment, which is highly fragmented segment, 650 pharmaceutical companies, there's a ruthless competition here. So we really have to focus and diversify our operation to international markets. This is a little bit one slide, which is a roadmap that how we should be getting into the international business. First of all, we need to focus on upgradation of our plants to international standards like PSES or EMEA or US FDA, which definitely requires a lot of investment, the time, the team, the technical skills, the expertise. We'll be needing that. And once we do the upgradation of the plant and machinery is not enough, because we have seen many companies invested on the plant, but later on they don't have the product dossiers to file in those countries. So what happens is that you have invested in plant, but you don't have the range of product that you can offer to international markets. So your robust formulation development is equally important as your plant upgradation. And those product formulation must be bioequivalent, and we should have the bioequivalent centers in Pakistan. Then we should be very careful about the patent protection, understanding of the intellectual property, because international markets are different. Pakistan is not very strict in terms of patent enforcement, but if you go to the international market, you need to be very, very careful. If you invest heavily in any dossier, and later you came to know that the patent will expire after 5 years, all your investment will go to waste. So you have to make sure that your patents are expiring, and you will be the first or the second or the first 10 to enter those markets. then you need to have a strong partnerships with your partners. Right now in Pakistan, APIs are not registered with DRAP, but you go to any regulated markets of the world, your API will be registered along with the dossier. You cannot use any API unless and until that API is registered with the regulatory body. So if you don't have a proper strategic partnership with those API suppliers, you'll have a serious concern with the supply chain at a later stage. Accordingly, you need to have a distributors, you need to have your business partner, trade channels. Every market is different, and you need to have a good understanding of those markets before you plan to invest in those areas. Then business modeling is also important. Not every market will be where you can set up your own sales team or your own marketing team. There are a few markets where you can go through partners. There are a few markets where you have to go through government agencies. There are a few markets which are very, very tender focused. Government tenders are very big markets there. So you need to understand each market before you make a decision of your international business or export. Now, second is because we have been focusing on the pharmaceutical export when we talk about the products from here, but we never talk about the services that we can do. Because if your plants are already approved by PICS or FDA or EMEA or MHRA, then you don't have to invest every time on the dossier formulation, because any dossier formulation on an average will cost you somewhere around $500,000 to $1 million, including bioequivalence study, if you do it properly. So instead of investing on the dossiers and the products, what we can do is that we can offer our services as a contract manufacturing to several companies. Because if you go to Europe, there are virtual companies having a revenue of more than $1 billion, and they don't have their own manufacturing facility. They don't have their own research facility. They outsource their research, they outsource their manufacturing, and India, China, there are so many other countries are offering contract manufacturing to those European and American companies. So this is the way forward, that with low investment on the dossiers, you can still generate a good export revenue through contract manufacturing and contract research. Approximately 30% of the manufacturing is outsourced in developed market. 30% is a big number. This rate is accelerating, by the way. This is a little bit analysis of what is the CMO market and what is the CRO market. CRO is contract research and CMO is contract manufacturing. So we'll see $116 billion is a contract manufacturing market, and $57 billion is a contract research. And we are not offering any services. This is the final slide. This is the recommendation that how to enhance our export. I think first of all, we need to have an independent authority who can facilitate pharmaceutical export, who can understand the need of export and what exactly is required. Because if you look at Bangladesh, they have a separate authority who is really helping the industry to generate the important foreign exchange. Then we need to have a bioequivalence centers in the country. We don't have a single bioequivalence center which is approved by any international body. And on an average, we need to pay around $60,000 to $100,000 per dossier for the bioequivalence study. Now, financing facility for upgradation. We cannot continue paying 25% interest rate and investing on the plant and machinery. We cannot ensure any kind of ROI based on this debt servicing. Then increase export retention, because in IT industry, recently the government has introduced 50% retention of the export proceeds. But here, where we do a lot of branding of our products in international market, we are hardly allowed to retain 15%. And 15% is not enough to cover any expenses of the international market. So it should be increased to 50% for the next 3 years. And there has to be a flexibility at the level of remittance with the State Bank. So thank you very much. Thanks a lot for your patience, for your understanding. Thank you.
Thank you so much, Javed, for that wonderfully insightful presentation. Fantastic stuff. Just a reminder for you, our volunteers will be coming and requesting your details with your NIC because Prime Minister Mia Mohammed Shehbaz Sharif will be in attendance this afternoon. We need to take all your details, and please make sure you have your physical NIC card with you this afternoon. And also, we'd like to welcome Dr. Fareed, Secretary of Trade, for joining us this morning. Thank you so much. Up next, we have our international keynote, Driving Pharma Export Success, Key Strategies for Manufacturing Excellence and Quality Control and Regulatory Compliance. Please welcome Senior Vice President of Global Health and Manufacturing Services from the United States Pharmacopeal Convention Incorporated, Dr. Emily Kane.
Okay, testing. Good morning, everyone. Thank you so much for the opportunity to be here. It's an honor to address all of you, and thank you to the Pakistan Pharmaceutical Manufacturers Association for the invitation. So I lead the Global Health and Manufacturing Services Division at the United States Pharmacopeia, and that includes a team of scientific and pharmaceutical experts that work with regulatory authorities and manufacturers around the world to help them reach international standards. This work is central to USP's mission to advance access to safe, quality medicines globally. So today I was given a pretty big topic and really asked to share reflections on driving pharmaceutical export success. And clearly there are many challenges, as we've heard. And I don't want to focus on these, but I do want to talk about some general principles. There's no one certain framework for export success, but there are some ideas and best practices that we can draw on as we think about export success. So I'm going to pick up on about 5 threads through this conversation. One, first and foremost, quality should be part of the strategy from day one. 2, regulators enable success, and commitment to DRAP's journey to regulatory maturity is essential. 3, Pakistan can build from its strength as it advances its export ambitions. 4, export success is stepwise, so Pakistani manufacturers can continue to build regional markets as stepping stones to more lucrative global stringent markets. And finally, it's good that we're all gathered together here because working together and collaborations are critical. So first and foremost, since I'm from USP, I'd be remiss not to talk about the quality bar. As we know, quality is not about the end product. It is ingrained in culture and permeates all work. As the US FDA has outlined, quality by design is about ingraining considerations for product quality and patient safety throughout the product life cycle. Though it's difficult to quantify, ingrained quality can reduce development time, costly errors, and rework. And most importantly, it builds trust and confidence for the company's reputation. If we look at the journey of Hikma, I think we have a really good example. Hikma was founded in the 1970s in Jordan and produced its first product in 1979. Today, it's an international pharmaco with a market cap of over 4 billion in British pounds. The journey was one of intention, and quality played a key role from day one. So don't take my word for it. I'm going to read verbatim from a Harvard Business Review case study on the company. It says, Darwaza, the founder of Hikma, set his sights beyond Jordan from day one. He wanted to produce high-quality, affordable medicines and become a business leader in the Arab world. Developing a reputation for quality was a priority, and the word quality was incorporated into Hikma's logo. To cement this notion in the medical community, Darwaza and his team regularly invited physicians to tour Hikma's facilities. By 1990, Hikma had 4 production facilities in Jordan and was exporting to multiple countries in the Middle East and Africa region. Darwaza's focus on quality was yielding results, making Hikma a trusted name in the region. In quotation, Harvard Business Review, quality integral to Hikma's strategy. The rest of the story is about how Hikma built from its strength and reputation to continue to grow and access stringent markets. Ultimately, Hikma became a globally known and publicly traded multinational pharmaceutical company. What I draw from the story of Hikma is a great deal. Just as with many of the pharmacos we support in developing countries, Hikma was founded as a family business by a pharmacist. The company had many struggles, including access to capital to fuel its growth. What is so profound about the story is that quality was integral to the business strategy from day one. It was literally ingrained in the logo. When Hikma determined to expand to stringent markets, the quality principles and systems had already been ingrained. There was no reworking or difficult culture change, which can literally take years to effectuate. Second point is that strong regulatory systems enable export success, and it is critical that DRAP continues its journey to regulatory maturity. A strong regulator is not a barrier, it's a growth enabler by leveling the playing field for quality manufacturers and by lending credibility to the local industry. Moreover, a local regulator aligned to international regulatory standards and practices simplifies entry into other markets and paves the way for accessing stringent markets. The impact of a strong regulator is somewhat difficult to quantify because often pharmaceutical industries and regulators are on the maturity journey together. I think one example that's really good is the journey of the Mexican regulatory authority, COFEPRIS. COFEPRIS enacted a number of important reforms in the 2010s, and what happened as a result of these reforms was that they were recognized as a model regulatory authority by the Pan American Health Authority. And what that meant is that the manufacturers in Mexico had access to numerous new markets in the region. This benefited them tremendously, not to mention that COFEPRIS was able to clear a backlog of 4,500 market authorization applications. So strong regulatory authorities matter. The Drug Regulatory Authority of Pakistan continues to make strides on its journey to regulatory maturity. Its commitment to achieving WHO Maturity Level 3, as well as its application to PICS membership, is just testament to that commitment. The journey is not easy and requires commitment from government and industry to make investments to implement and invest in new standards such as bioequivalence, and that's a tough one. So number 3, Pakistan does have many strengths on which to build towards its export ambitions. So we all know the lessons learned from the COVID pandemic, and now we have economies around the world who have prioritized building a local production base to secure their pharmaceutical supply chains. This is true in the United States, Europe, Africa. Pakistan, where 90% of all locally consumed generic medicines are produced in country, is in an enviable place in this regard. This strong pharmaceutical domestic industry matters not only for health security, but also benefits the Pakistani economy and constitutes a base from which to build. The industry has done well to capitalize on the large and growing domestic market to achieve economies of scale that enable cost-effective production. Recognizing the challenges, this still provides an opportunity from which to build. The presence of a large industrial base does indicate the availability of a skilled workforce that can continue to develop. Pakistan also benefits from the presence of strong research institutions and universities, which can serve as a valuable talent pipeline and an R&D resource. So much to build from. Point 4 is that export success is typically stepwise, so beginning with the local market, then regional, then global stringent markets. One good example is Turkey. So Turkey implemented a comprehensive pharmaceutical industrial strategy. It focused on a number of the elements that we've already talked about. So strengthening R&D, increasing investments in the sector, and improving the regulatory framework. But most importantly, they strategically targeted friendly markets, so the Middle East, North Africa region. This focus on countries with geographical proximity, cultural familiarity, and their ability to provide competitive pricing helps support their entry into these markets. Today, their export market is approximately $1 billion in 2020. Malaysia is another good example. They not only focus on countries in their region, but on supplying an unmet need for halal pharmaceuticals. The other lever that they pulled was really focusing on regulatory harmonization and conversion with the ASEAN and GCC countries. So regulation as an enabler is a common thread that we're picking up across all the points. Finally, working together and collaborations are critical, and that's just not a nice thing I'm saying because we're all here. But we are gathered together under the auspices of the Pakistan Pharmaceutical Manufacturers Association. And the key topic is how can we build from strength and potentially leverage collective or collaborative approaches to gain advantages. In addition to the role of government in creating an enabling policy and trade environment, the Industry Association has an important role to play. PPMA is already doing a great job, as we can see, by bringing us all together and organizing this high-profile event. We all know that PPMA already conducts advocacy, knowledge sharing, networking, and training for its members. These can continue to be expanded. There may be further opportunities for collaboration where the association can play a role. One recent example is found in Bangladesh, where the Industry Association, or BAPI, has coordinated plans to share laboratory and waste disposal facilities among the industries entering a new API production park. This is enabling its manufacturers to achieve economies of scale and compete on the global markets. So, in summary, competing in export markets requires a long-term commitment, significant investment, and continuous improvement with an unfailing commitment to the quality of culture and with quality underlying it all. By utilizing its large domestic market as a stepping stone, the industry is well positioned to grow exports and become more competitive globally. The government's declared focus on pharmaceuticals, coupled with an enabling policy framework, advancing regulatory reform, and growing trade linkages, can provide a solid foundation to help grow the pharmaceutical industry and strengthen its position in the global pharmaceutical market as a trusted partner. Working together as a manufacturers association can provide further competitive advantages to the industry as it aspires to export markets. Thank you all for your time and the opportunity to address this important gathering.
Thank you so much, Emily, for that wonderful presentation and talk there. While we're just waiting for our next esteemed guest to arrive, I just have to do a couple of reminders. Our volunteers will be going around taking your details, and we need all of those along with your NIC numbers, please. And you will need to carry your original with you after lunch, because we will have Prime Minister Mian Mohammed Shahbaz Sharif in attendance, so that's very important. Thank you so much. Just to give you a rundown of how the rest of the day looks, we will be having an address by one of our esteemed guests very, very shortly. We're just waiting for him to arrive. We'll be also honoring some wonderful people here today. Coming up, we've got a panel session which is going to be looking at the industry and also the problems. The discussion will be looking at the successes and the stories of top pharma exporters in Pakistan and beyond. Plus, we've got more panel sessions to come and more talks as well. Like I said, we're just waiting a few minutes for our next esteemed guest to arrive, so I'm just waiting for some details on that. But it's amazing to have you all here and wonderful to hear so many different insights and also success stories and the challenges that the industry is facing. So we will continue very, very shortly once I got an update on what is happening with our next speaker. we go to coffee break? And ladies and gentlemen, please can we give a nice warm welcome for one of our chief guests, Syed Naveed Khamar, Federal Minister for Commerce, Government of Pakistan. Absolute pleasure to have him here with us today. And I know, sir, that you've just sat down, so I'm going to ask Mr. Khamar if he would please come up and just give a welcome address. If you'd like to just give a nice welcome address for us, that'd be great.
Good morning again, Assalamu alaikum. We are honored that our Honorable Minister for Commerce, Naveed Khamar Saab, has honored us with his presence today in the Pharma Summit, second Pharma Summit Export Award today, held in Sarina, Islamabad. We are honored, sir, and thank you very much for sparing time. I have been told that you are coming from Karachi all the way to attend this program. Thank you very much. And obviously, the economics of Pakistan, the commerce and trade is your subject, is your domain. And the export is, I know, is very close to your heart. And you really want that the Pakistan export all sector men, but particularly we really request you to help us in pharmaceutical export so that the Pakistan, made in Pakistan brand can be established all over the Pakistan. Thank you very much, sir, and welcome again.
Thank you so much, Dr. Waheed. Right then, let's do some mementos distribution at this point. So we would like to ask, please, our chief guest, Syed Naveed Khamar, to present mementos to... Okay, sorry. We'll do that afterwards. Would you like to come up and give a nice welcome address, please? Thank you so much.
Bismillahirrahmanirrahim. I'm grateful to the organizers of the PPMA summit that is being held at Sarina today. It is our job in the Ministry of Commerce to create the environment which will help our entire industry to move forward and enhance the trade, particularly exports, but generally trade, from Pakistan all over the world. I can see some household names, some familiar names from the industry all around, because this is one of those diversifications that we are hoping to push in terms of our exports worldwide. Having been around the world, particularly certain areas where I see huge potential for the pharmaceutical industries to lead our exports. While still today, bulk of our exports are in the more traditional industries, I think amongst the areas where we hope to get breakthroughs besides IT and agriculture is the pharmaceutical area. The entire Central Asia is now a potential market. Some of you already have left your footprints there, but there's so much more. I think we have only scratched the surface in the entire Central Asian markets for pharmaceutical industry. It is a fast-growing industry, of course, with a huge population, even domestically, to service, that has provided the base. But it is our task as the government to encourage manufacturing at a sustainable level, both for domestic consumption as well as for exports. All the inputs that go into the manufacturing of our pharmaceutical products have to be allowed in tax-free initially, and then hopefully converted it into localization and creation within Pakistan. There are some distortions in the domestic market also due to price fixation, which have in more recent times been a source of annoyance, if not actual friction, between the government and the industry. For us, fixing the price to make it affordable has to take into account the cost of production and the profitability of the industry. Without that, all we are doing is creating black markets and non-availability of essential medicines in the country. So we in this Ministry of Commerce always try to push for a more realistic pricing regime, and that has been our endeavor even in the forums like Cabinet and Economic Committee of the Cabinet, whereby we support the industry to keep on moving forward without charging exorbitant prices. If we don't make the medicines affordable for the local population or profitable for the industry, then we cannot hope for export earnings from any product, let alone from the farmer. So we are here to serve you, make life easier for you, listen to your problems, and try and resolve it, both as a member of the outgoing government and potentially the next incoming one. We will look forward to hearing from you, hearing the issues, and see how we can go hand in hand and achieve the goals, which I believe are our common goals. Thank you very much for inviting me. And inshallah, we will progress together.
Thank you so much, Minister, for that wonderful address, very poignant marks made as well, and wonderful to have you here. It's truly an honor and a privilege. And we'd also like to acknowledge the presence of Mr. Zubir Mutawalla, CEO, Trade and Development Authority of Pakistan and PPMA. So welcome to you. Now we'd like to give over some mementos. So Chief Guest, Minister, I would like to ask you to give these out, if that would be so kind of you. And we'd like to welcome up Javed Ghulam Mohammed and also Dr. Emily Kane to receive their tokens of appreciation, please. Yes, go ahead. If you give it to the minister, give it to the minister, to give it to Javed. Yeah. Emily, wait, Emily. Emily, can you just stay on stage for a second, please? Emily, thank you. And now if we could please ask Mr. Farouk Bukhari to give our chief guest a token of our appreciation. Thank you so much. And now I think Haroon would like to say a few words before we do our group photo.
Thank you, Mr. Saab. First of all, my apologies, Honorable Minister, that we could not give you a brief about what this summit is about. Alhamdulillah, this is the 6th Pharma Summit we are holding under the banner of Pakistan Pharmaceutical Manufacturers Association. As you mentioned, that the pharmaceutical industry is a pivotal industry of this economic sector of Pakistan. Today, we are gathered here to discuss about the exports of the pharmaceutical industry of Pakistan. It's an honor that you are here for us, especially as you mentioned that commerce is the backbone of any country. Honorable Minister, today in the early afternoon, we will be having the Honorable Prime Minister coming to distribute the export awards to the top 50 companies of the pharma industry. Honorable Minister, you rightly mentioned that we as an industry have to work hand in hand with the government of Pakistan to facilitate the exporters and the business. And you rightly pointed out about the tax-free incentive, as well as the pricing which is a very, very burning issue. And I'm very happy that you mentioned that the pricing, especially of the very low value price products, become short in the markets, and then they are black market. And in the end, the patients suffer due to non-availability of these highly needed medicines. So overall, this summit is all about the pharma industry and how together we can contribute towards the exports of this country. Today we had early morning, one of our distinguished members of the industry mentioned about the entire regional markets as well as the Pakistan market and how Pakistan exports can grow. We have an international speaker, Ms. Emily, who flew in from US. She represents United States of Pharmacopoeia. She talked about how the exports can be grown, and she mentioned 5 points which can help the industry to grow the exports. So we are thankful to Ms. Emily to fly all the way to US, from US to come to Pakistan and share her thoughts. And let me mention here the United States Pharmacopoeia is helping the pharma industry in Pakistan to how to grow in the exports as well as train the local workforce. So Honorable Minister, on behalf of my chairman, Mr. Farooq Bukhari, my organizing committee, Mr. Dr. Sheikh Kaisar Waheed, Mr. Asad Shuja, Mr. Hamid Raza, I'm very thankful that you took time out and honor this, or your presence in this summit. Thank you very much.
Thank you so much, Haroon Qasim, Co-Chair Conference Committee, for that wonderful talk there. Thank you so much, gentlemen, for being here on stage this morning. Thank you, Federal Minister, for joining us. We'd now like to send you for a short coffee break, and when we come back, we'll be having our first panel session of the day, which I'll be moderating myself, and I'm very excited for that. But before I let you go, can we get a nice group photo of you all on stage, please? That would be wonderful. Photographers, if you'd like to come for a group photo. Photographers, if you'd like to take a group photo of Emily and Javed, if you'd like to join us, please. Have you got everyone in, photographers, or do they need to scooch in a little bit? Thank you so much, everybody. Now we'll have a short coffee break and reconvene at about 11:30 for our next panel session. And a reminder, please do have your NIC details with you, and we'll be requesting that you carry your originals after the lunch break, but make sure you give our volunteers all your details. Thank you so much. Hi, how are you? I love curveballs. Yes, what is your name? Who are you on my list? Okay, so Hamid, okay, no problem.
What I want to ask you is, we start with like a kind of...
Well, now to take your seats. Thank you so much. You all now to take your seats. Thank you so much. So we could get this morning's event underway. Ladies and gentlemen, can I please request you to take your seats so we can get any milestones that you have, challenges that you face, and strategies.
Any question particular?
I have the 10 questions I put in the group saying, is there any one of those 10 questions that you particularly wanted? So some of the others have responded saying they want this question targeted at them. But otherwise, I'll just, if you're happy to talk about anything.
I want to talk about one particular question is going to be that.
Oh,
sorry.
that's okay.
What I want is that the main question, right, which we all are going to address here, is that what are the factors
Yeah.
that we have not achieved that export potential,
Okay.
which a country deserves to achieve with such a huge number of pharma industry.
Okay, so we'll just say, what are the factors stopping the export
Yeah,
potential,
yeah.
right?
And what are the factors? This is the question I want you ask me.
Okay.
Apart from the initial 3 minutes.
Yes, but because we have like an hour, so we're going to be. It's a long panel session, so we'll go down the line and we'll just. But I want it to be a discussion, so by all means, disagree with other people.
Because the regulatory is here. One of the 4 factors which I will mention.
Yeah.
One is about the industry.
Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP.
gentlemen, if I can request you to please come back and take your seats so we can get this morning's first panel session underway. If I can request you to please come back and take your seats. And just a reminder to please fill out your details on the forms that our volunteers will be bringing round. We will need your full information plus your NIC details, and you will have to have your NIC cards with you after lunch this afternoon. Thank you.
State-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state of... Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP.
Thrilled to be moderating the first panel session of the day, which is going to be on unveiling success stories of top pharma exporters. And we're going to be listening to inspiring journeys of top pharma exporters at this summit. We're going to gain valuable insights into the success stories, the challenges they faced, and strategies employed to become industry leaders. I'd like to give a warm welcome to our panelists. Can we please welcome up to the stage Nusrat Munshi, AGP Limited, and also Atif Idris Siddiqui from CCL Pharma, Karat Ul Ain Irfan, Pacific Pharmaceuticals Limited, Adil Abbas, High Noon Laboratories, Haroon Qasim, Farm Evo, Mr. Arshad Mahmood, the North PPMA Chairman, Hamid Raza from Neutro Pharma, Mujud Ul Hassan from the Cell Company, and Turkiya Ul Haq from Sante Limited. It's a big panel today. We're going to have lots of insights. Wonderful. Is that everybody, or do we have one? We have one person missing. How many is it? 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, fantastic. I think everybody's here. That's great. So thank you all for joining us today. And what I'd like to do, the microphones you have in front of you, just turn them on, press the little button so the red light comes on, then you'll be able to speak to everybody. What I would like to do to begin with is just to go down the line and for each of you to tell us a little bit about yourself and about the success stories you've had as a top pharma exporter, and highlighting any key milestones and your challenges faced and the strategies that you are doing that to deal with. So I'm going to start with Haroon right at the end there. If I can start with you.
Bismillahirrahmanirrahim. Thank you, Emma. My name is Harun Qasim, and I'm the Managing Director of Pharma Private Limited. And I'm also the co-host chairman of this Pharma Summit and the PESA Award. Very briefly, I think success is something which you earn from your failures. It's easier to talk about successes, but I think it's very difficult to talk about the failures. So what I would like to start with, maybe mention few of the failures which lead us to success of exports in the international markets. I think the pharmaceutical industry as a global phenomena is a very, very intensive industry. And I remember I started, working on the export markets in 2003. And we went to regional markets, we went to global markets. And it took us about almost 10 years before we could figure out how to channelize our exports into international worlds. First of all, when you go to the international markets, it's very challenging to understand those markets, especially you have many language barriers, you have to understand the local context of the industry, and then you have to look for the business partners. So I remember when we went to the regional markets, especially the Far Eastern markets like Myanmar, Cambodia, Vietnam, Philippines, it was really a struggle to have to find the distributors and then introduce and launch our products. And also the registration of pharmaceutical products takes a long time. So failures after failures, eventually we reached to a point that we could hire or we could make business partners in the international markets. What leads to the successes, I think, one was as Dr. Emily mentioned in her remark, and I think it's a very, very valid point for any exports. It goes without saying wherever you are, I think the quality aspect is something which Pharma took to the heart, and we really believed in the quality of our products, and we stood by that. And we took that quality aspect to the international markets. And then we improved our processes. We implemented SAP, which is a global software for processes and controls. And then, we went for international certifications, which one of my colleagues in his keynote speech mentioned, Javed Ghulam of Martin Dow, that it's very important that to go into the international market, you have to have certification. So it took us about 10 years before we went to WHO certification, and only last 2 months ago, we were awarded with the WHO certification. So overall, there were many failures which led to this success. And I think it's important for any company to go into the international markets. Without failure, you will not have a success. So it's important that you fail, and then, eventually you will learn and you will succeed. So I would, my 2 cents will be for any of my colleagues in the industry here, that you have to embrace the failure, and then eventually you work hard and you reach to the success levels. So this is what I would, add to this. Thank you.
Thank you so much. And then if I could ask the gentleman sitting next to you the same. So basically highlight some key successes and any challenges that you've faced.
Hello. Assalamu alaikum and good afternoon. My name is Maujud Al Hassan. I'm working Chief Operating Officer Global Business in this our company. So as Mr. Arun mentioned, that the success is the result of long efforts and continuous improvement. I joined this company in August 2014, almost 9 years back. At that time, exports were degrowing, and distributors, which they have, were not happy, team were not happy. So when I took over the charge, first thing I did, I write down all the challenges which the team and the cell company is facing. And we identify that major challenges are the internal instead of the external. So to address the internal challenges, obviously, I made a list and then I discussed our managing director, Mr. Nadeem Ahmed, who was willing to make SAL also the major export player of the Pakistan. Anyhow, cut it short, the first thing we did is we try to change the mindset of our people, particularly the technical people who are not ready to make CTD dossiers. Then there's a long or huge list of the heavy investment which you need, like R&D center. We had 4 plants, but no R&D center, no QC lab properly. So we have now a centralized R&D center where we are developing many new products, and also a small R&D center in every plant. So it took 3 years to change the mindset and everything. And in 2017, we started submit CTD dossier. Similarly, for the external challenges, one is the regulatory challenge which every company is facing. The second challenge was that the distributor which were hired before me, the team which were hired before me were not enabled to promote or proper establish SAL product. So what I did is, I established first head office team and recruit one of the best people available in the industry. And slowly we start revamping up our operations. We started from one country, Afghanistan. We fire all the distributor, all the team. We changed distributor and team. Similarly, we went to Sri Lanka. We changed distributor model. From distributor model, we start our own marketing sales team. This is we have done. And on the other hand, what we have done is that we hired the best regulatory consultant company in each of the countries. Instead of using regulatory team of the distributor which were not performing well, we hired the consultant. And through consultant, we start registering our product. So in 9-year time, if you see, now SAL is operating in more than 20 countries from Pakistan. We have around 800 registrations in different countries. Our team size is more than 300 people dedicated only promoting SAL product. So this is the success which we have achieved, but by passing these all the challenges. My recommendation would be that first, the government should support to the pharmaceutical exporter in terms of that help us to, reimburse something from the registration fee, plant inspections, and to derive that we should have accredited bioequivalence lab here. Like Bangladesh government is helping the Bangladeshi companies for the BE, Indian government also helping for BE, but our government is not helping in registration fee, plant inspection, BE, which is at the moment is a big challenge to the industry.
Okay.
So still I believe that export opportunities from Pakistan to CIS, to Southeast Asia and Africa, there is a huge potential if our government will support us to help us to get a more and more registration. Thank you.
Okay. Thank you, Majood. Thank you. And gentlemen, next to you, the same. We just keep this initial bit just short so then we can get to the questions and get into discussion. That'd be great. Thank you.
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. I'm Hamid Raza. I'm representing my major companies, the Pharma Private Limited. But we have other companies like High Nutrition, which we produce the nutraceutical products, and NS Pharma, Radiant Pharma, and Ali Industries. I would like to share that we are one of the first companies who got NSF certification from the US in the nutraceutical category. That helped us to access the US market. And right now, we are one of the few companies who are exporting their products to the US and UK market. And we are also first company to be listed on the Amazon in the gated category from Pakistan. And the real vision or the challenge or the thought was to, as we had the top brand of vitamin D3 in Pakistan, we are the brand leader in this category. So I wanted to share this good product with the other countries. Right now, we are exporting our pharmaceutical and Nutra products more than 10 countries. And the biggest success I regard as my company is the access to the most biggest and the regulated market of the US and UK. It's not a big success in terms of volumes at the moment, but I believe that we'll be able to develop our brand with our strategies in the near future. And in addition to the vitamin D3, we'll be adding more products in the UK and US portfolio. Thank you.
Thank you. Takia?
Ji, Assalamu alaikum ji. I am Tawqirul Haq, Managing Director, Sante Pharmaceutical, and I'm also ex-chairman PPMA. I think in order to expand your business in export market, the most important factor is agility and drive. We should always be agile in terms of looking into the external factors in the countries in which we are operating. And at the same time, we have to have a drive to continuous improvement in terms of our product portfolio and investment in our plants. So as a pharmaceutical company, mashallah, today we are one of the largest exporter for ophthalmic products, which is eye care products. And we are exporting our products very successfully in 7-8 markets. We are number 3 ophthalmic company in Sri Lanka now. And in the next few years, we'll be entering into at least 6 countries more. So the success for us as exporter, because now the total contribution of our company is more than 30% in terms of export business. And we have our leading brands in all the countries in which we are operating, like Afghanistan, Uzbekistan, Sri Lanka, and many other countries. So the success came because always me and my team tried to keep a finger on the pulse. We should always be able to find out the opportunities, and quick decision making is key to success. For example, you know, in order to be a successful exporter, first of all, the most important thing which I would like to share with the audience is that selection of the market is number 1 priority. Because in order to get your products registered outside Pakistan, it needs huge investment in terms of documentation like CTD format and, you know, lots of testing and inspection of your plant. So it's not like a garment product. If you want to register your product, it takes 2 to 3 years to get it registration. So you have to be very, very, selective. You should, identify the countries where the low-hanging fruits are there, and you are able to, chip in that country easily. You have to see the banking channels, and you have to see the right, the second step is that you should, for a newcomer, I think the most important thing is that you have to select the right partner there as a distributor. Because from the day one, you cannot, go there and have your own team. So product, selection of the country, then the product portfolio. For example, my success story is that 90% of my export business is ophthalmic business. Why? Because I saw that there was less competition in ophthalmic market, because if I go for other therapeutic areas, there were so many competitors. So we selected ophthalmic range, and we were able to, penetrate so successfully. And, we are competing so, like in Sri Lanka, if we are number 3 ophthalmic company, that means we are doing much better than, Indian and Bangladeshi companies. So product portfolio is very important. And then I think we should always invest in terms of quality, because outside Pakistan, if your products will only be established as a brand if you continuously provide quality products. Otherwise, you will not be able to sustain in that market. So I think this is the major factor, that, selection of market, product portfolio, and continuous improvement. And you have to, make sure that you should be able to establish your brands. So this is the whole success story for my company, and we are, continuously, improving our business. And considering the current circumstance of our country, I think all other companies who are still thinking to, invest, I would suggest that they should invest in export, and that is the way forward for a successful survival of pharmaceutical industry. And this will also bring revenues to the country as well. Thank you.
Thank you, Takia. And Arshad, on to you.
Bismillah ar-Rahman ar-Rahim. My name is Arshad Mahmood. I'm chairman W Group of Industries that comprises 17 manufacturing plants in Pakistan. मैं चाहता हूँ कि मैं ज़रा इंग्लिश और उर्दू दोनों में बात करूँ. इस वक्त जो पाकिस्तान की सिचुएशन है इकोनॉमिकल, परसों जैसे प्राइम मिनिस्टर ऑफ पाकिस्तान और चीफ ऑफ आर्मी स्टाफ उन्होंने जो ग्रीन नेशनल कॉन्फ्रेंस की है, ग्रीन रेवोल्यूशन की, कारपोरेट फार्मिंग, और यानी उनका जो मेन फोकस है इस वक्त हमारा एक्सपोर्ट के ऊपर है. और बीइंग एन इंडस्ट्री फार्मास्यूटिकल, वी मस्ट नो वी आर लकी इनफ कि वी आर इन अ बिजनेस दैट इज़ एन इंटरनेशनल बिजनेस. और टेक्सटाइल की हमारी जो एक्सपोर्ट है और टेक्सटाइल की जो इंटरनेशनल मार्केट है वो है $1,200 billion. बट pharmaceutical international market is $1,800 billion. Our government should realize this thing कि pharmaceutical का जो scope है international वो even textile से भी ज़्यादा है. और इसकी एक दफ़ा जैसे मेरे seniors जो हैं इस बात को कर रहे हैं, I'm really appreciate the efforts of my seniors कि वो इस topic को, इस main variables को इतना अहम समझते हैं कि हमारे हर साल एक फार्मा समिट के नाम से, ये नाम इसका वैसे पीसा है, मैं समझता हूँ पैसा के नाम से, ये इसको अगर आज से जाना जाए कि हमने डॉलर्स कैसे कमाने हैं और इंटरनेशनल मार्केट में बीइंग फार्मा इंडस्ट्री हमने कैसे इंटर होने हैं. तो उसमें जितने हमारे चैलेंजेस हैं, हर की स्टोरी जो है सक्सेस मोर और लेस सेम है. जो बहुत सीनियर्स हैं उनको तो फर्दर हम गाइड नहीं कर सकते, लेकिन जो हमारे साथ खड़े हैं, जो अभी हमसे जूनियर हैं, आई वुड लाइक टू एडवाइस दोज ऑल कि हमें इसमें एक तो पेशेंस की ज़रूरत है और हमें उन मार्केट्स को पहले टारगेट करने की ज़रूरत है जहाँ पे अभी इतनी स्ट्रिंजेंट जो है हमारी रिक्वायरमेंट्स नहीं है. और देयर आर सो मैनी कंट्रीज़ जहाँ पे लोगों को पता ही नहीं है और वी कैन एंटर. हम सिर्फ एफर्ट ही नहीं कर रहे. और ये जो एक्सपोर्ट का प्रोसेस है ये थोड़ा सा इसमें हमें टॉलरेंस और पेशेंस चाहिए. ये नहीं है कि आज ही हम शुरू करेंगे और अगले दिन हमारी एक्सपोर्ट शुरू हो जाएगी. जैसे तोकीर भाई कह रहे हैं कि इट विल टेक एटलीस्ट 2 to 3 years. 2-3 साल आपने जस्ट इस डिपार्टमेंट को सैलरीज देनी है और आपके जो लोग हैं दे शुड विजिट द मार्केट पर्सनली. जस्ट आप इंटरनेट पे बैठ के और बाकी सिर्फ आप एक्सपो में किसी में जाके ये बिज़नेस नहीं कर सकते. हमारी इस वक्त एक्सपोर्ट जो है डब्ल्यू ग्रुप की अल्हम्दुलिल्लाह 16 कंट्रीज़ में है और हमारी यानी उन कंट्रीज़ में एक्सपोर्ट है जिनमें बहुत ज़्यादा अभी इस लेवल की रिक्वायरमेंट्स नहीं है. दूसरी बात जो क्वालिटी की है, जैसे तोकीर भाई ने कहा, अगर आप क्वालिटी पे कॉम्प्रोमाइज़ करेंगे तो ना आप लोकल मार्केट में सर्वाइव कर सकते हैं बीइंग इन फार्मा इंडस्ट्री, और ना ही आप इंटरनेशनल मार्केट में कभी भी इंटर हो सकते हैं. अगर गलती से एक दफ़ा आपको कोई चांस मिल भी गया और आपका प्रोडक्ट चला भी गया तो कभी आपको रिपीट ऑर्डर नहीं आएगा. तो इसलिए हमारे इस वक्त मुल्क की भी ज़रूरत है, कंट्री की जो इस वक्त बीइंग नेशन हमारी ज़रूरत है. हमें अपनी एक्सपोर्ट को बढ़ाना है, अपनी इंपोर्ट के सब्स्टिट्यूट्स डेवलप करने हैं. अभी तक हमारी जो बेसिक रॉ इंडस्ट्री है वो डेवलप नहीं हो सकी. 93% जो है अभी तक हमारा रॉ मटेरियल जो है वो इंपोर्ट हो रहा है. तो हमें जो ट्रेड डेफिसिट को कम करने के लिए हमें हर एक को वी मस्ट रियलाइज इंडिविजुअली कि हमें अपना फोकस जो है एक्सपोर्ट के ऊपर लेके जाना है. हम कुछ डॉलर्स कमाएंगे, हमारे रिजर्व तब बढ़ेंगे, तब हमारे दूसरे मुल्कों में इज्जत भी होगी, हमारी इकानमी बेहतर होगी. हमारी सिर्फ फार्मास्यूटिकल की इतनी बड़ी मार्केट है कि हमारी जो इकानमी है पाकिस्तान की वो तो 10,000 बिलियन रुपीस की है और यहाँ पे 1800 बिलियन डॉलर की इंटरनेशनल मार्केट है. अफ्रीका की मार्केट जो है वो तकरीबन 86 बिलियन डॉलर की है. तो हम थोड़ा सा इसको फोकस करके, मैं समझता हूँ सक्सेस की जो डेफिनेशन है वो है कंटिन्यूअस एक्चुअलाइजेशन ऑफ योर आइडियाज़. अगर आपने अभी सोचा, आपने सुना कि यार हम एक्सपोर्ट में जाना है और यहाँ निकल के आप भूल जाएं और इसको प्लानिंग में नहीं डालेंगे कि यार अगले 1 साल में या 2 साल में मैंने इस मुल्क को टारगेट करना है, तो तब तक आप एक्सपोर्ट को शुरू भी नहीं कर सकते। आपने इन चीज़ों को यहाँ से लिख के ले जाना है। सारे जितने यहाँ पे लोग बैठे हुए हैं अल्हम्दुलिल्लाह दे कैन गाइड यू। जो अभी ये बता रहे हैं, अगर इनमें कोई अहम बात आपको समझ आ रही है उसको ज़रूर लिख लें। जो बंदा बात लिखता नहीं ना, वो एवेपोरेट हो जाती है, उसकी कोई वैल्यू नहीं है। आप यहाँ से जो सुन रहे हैं, यू फील लाइक कि ये बात जो है अहम है, उस बात को ज़रूर लिख लें और उसको जाके कल से ही, आज से ही शुरू करवा दें। मैं समझता हूँ कि आप अपने बिजनेस को, वी आर लकी अगेन, आई एम सेइंग वी आर लकी इनफ, वी आर इन ए बिजनेस दैट इज़ एन इंटरनेशनल बिजनेस। अगर हम इंटरनेशनल बिजनेस में लकीली आ ही गए हैं या प्लानिंग से आ गए हैं, तो अभी हमें इस चांस को अवेल करना चाहिए और हमें इंटरनेशनल मार्केट जो है इसको ज़रूर, मैं रिक्वेस्ट करूँगा प्रेजेंस का उठाते हुए जो हमारे सीईओ साहब हैं, कि एक्सपोर्ट में पहले भी ये रियली विद अस, जहाँ भी हमें एक्सपोर्ट में ज़रूरत है, 1 विंडो ऑपरेशन शुरू कर दिया और बहुत सारी चीज़ें, इसको फोकस करके मैं समझता हूँ इससे बड़ा सदका जारिया नहीं है। मुल्क बचाने के लिए इससे बड़ी कोई एफर्ट नहीं है कि अगर हम जो है एक्सपोर्ट के ऊपर फोकस करें। और ड्रैप से मैं समझता हूँ जहाँ पे ड्रैप हमारी हेल्प कर रही है, इसको अगर को 2-3 गुना ज़्यादा कर दें और इसका फोकस और प्रायोरिटी चेंज कर दें, तो हमारी एक्सपोर्ट जो है, देखिए बांग्लादेश 2015 में उनकी सिर्फ $7 मिलियन की एक्सपोर्ट थी और अभी मेरे ख्याल में $1.8 मिलियन पे अभी वो पहुंचे हैं और उनका जो 2027 का टारगेट है वो $5 बिलियन का है। तो
sorry, please wrap up because we need to, before we get to questions.
तो अगर हमने इंडिया और बांग्लादेश को कम्पीट करना है तो हमें अपनी एक्सपोर्ट को फोकस करने की जरूरत है। थैंक यू वेरी मच।
Thank you. Adil?
I'm Adil Abbas, Group Managing Director and CEO of Final Laboratories. Thank you very much, Emma, for providing this opportunity, and Pakistan Export Summit. Harun Saab, thank you very much for providing this opportunity. Let me start with this admission that I'm sharing the stage with the companies who have done exceptionally well compared to us in the export. And I'm here, I'm glad that I'm here, that we'll be able to learn something with the experience of a few other companies as well. Still, I would like to share the bit of mine, what we have done in last few years. Though we've been there in the market for last 30 years, and we started off, we were the pioneer in export business in Pakistan, but there were many companies who were ahead of us in the middle. And then back into 2020, we got into the situation when in COVID, we realized that there was a great acceptance about preventive healthcare. And there was also a great awareness about using dietary supplement all over the world. So this was something which made us realize that this can be an interesting opportunity to explore globally. And this was the point from where we started looking at the dietary supplement market. Now let me also share with you that people also already usually get confused with dietary supplement market. Dietary supplement market is different than the nutrition market. According to Fortune Business Insight, back in 2019 or 20, the dietary supplement market was somewhere around $70 billion. Whereas Nutra market was almost $350 billion. And according to the business, Fortune Business Insight, they were expecting that by 2028, this market would be somewhere around $128 billion. So this was a big, huge opportunity for us. And being pharmaceutical company, we knew that QBD, I'm glad that Emily mentioned in her presentation, QBD was something which can help us, which can be a unique selling proposition for us. And this was the point we actually started working for USP. And Route to Health, which is an associated company of Hynum, was the first company in Pakistan and Asia who got this USP certification in Pakistan. And this indeed helped us a lot. Today we marked our presence in multiple countries, Sri Lanka, CIS, Far East, and interestingly, we already had an agreement with our very global partner with us, which is Engelhard, German company. So what we did, we went into an agreement with them, and now we are, very soon, we'll be launching one locally manufactured cough syrup, which is a global brand, in Philippines very soon. So this USP certification helped us a lot. So this was the bit from our side that what we did in the export, and we are looking forward to capitalize on this opportunity in the future. Thank you very much.
Okay. Thank you, Adil. Kurat?
Assalamu alaikum. Dr. Kuratolan from Pacific Pharmaceutical. I won't take much of your time. We achieved MHRA. I think achieving accreditation is very easy, but keeping it on CGMP guidelines is very, very difficult. You have to live GMP, you have to follow each step, you have to work for data integrity, and we are so much advanced in IT, but there is not a certified lab who could give us a certificate that your computer system is integrated and you cannot change with it. We change our CFR compliant QC equipment, but we cannot do anything with the computers. So we have to develop on those lines also, and adding to new GMP guidelines from WHO, ICH guidelines, you have to be more vigilant after getting the accreditation. And one thing, interesting thing that I learned by supplying to the SRA markets, we have a ACG machine installed in our company, and this is attached with 2 servers, Tracelink in UK and one in our computer section. During process of a batch, few packs were smudged, and as a routine, our people, they just didn't include in the total number of packs used, but it was detected by the server in UK. So we have to justify these minor things and coming up with the answer to their queries. So I suggest we all should go work for more accreditation and keeping us staff.
Oh. You go.
What's the last line? So we should also. Hello? Yes. We should also detect and integrate our production facilities, our systems to keep to the standards, international standards. And I learned the word preventive maintenance of equipment. This is very important. We have to have robust equipment if we want to search for stringent markets. And we are also in line working with USP and WHO and PQM for our 4 FTCs and TTB, and we are willing to go for WHO accreditation for one of our products, and we would like to have more products. It's not the only product.
Can we have another microphone? Can we have another microphone, please? Can you bring some more handhelds, please? Thank you. Because we're not sure about these stage microphones. Thank you.
No, thank you. Thank you very much.
Asif?
Hey, Emma. Good afternoon. Thank you, everyone. Assalamu alaikum, everyone, for the time which you are, giving us today. And I think I agree with Adil and many of the guests, the panelists on the stage that I really feel very proud sharing the stage because, many people on the stage perhaps and on the floor also have done a much better job than perhaps many of us on the stage. So well, I'm Atif. I'm working as Chief Executive for CCL Life Sciences, which is the international arm of CCL. Just to introduce a bit about CCL. CCL is a conglomerate operating in 22 plus countries. We have 3 manufacturing sites, 2 in Lahore, 1 in Ho Chi Minh, Vietnam. Well, broad and large, our mission when it comes to CCL is to enable healthy and happy lives by providing healthcare, quality healthcare solutions. And that's perhaps, approximately 3,000 people working with CCL believe in, and they make sure that this attempt is made, with full justice on a daily basis. Now, coming to exports, perhaps, Emma, there's a common saying which says that failures are orphans and success has many fathers, So, in our case, I think, like any other company, we went through quite a few failures. But I think keeping in view how CCL is designed, let's say the key therapeutic areas where we operate are chronic care, which is cardiometabolics, neuropsychiatry, respiratory. So perhaps keeping in view how the dynamics, or there's a paradigm shift in the healthcare landscape because of the aging population, I think by default, CCL fits, in most of the cases, because whenever there's an aging population, people will end up into chronic care, they will be needing chronic care solutions. And perhaps CCL is an organization which tries to fit by providing healthcare solutions in diabetes, cardiovasculars, and many other diseases. Now, there's no quick fix for success, as we all know, and one size does not fit all. So I also agree with many of my colleagues sitting here that you have to, at times, in fact, with us, we try a level best to think global and act local. One size does not fit all. However, it is extremely important to make sure, especially during the current years, where we are all witnessing a severe decline in the global GDP. We need to understand which markets are better to approach. For example, these could be pharma emerging markets, which are good 17, 18 in number. Out of those 17, 18 markets, luckily CCL operates in 4 out of 17 markets, including Pakistan, as we all know. However, there's no doubt about it that R&D, quality is key. I think as an organization, over the years, we have evolved significantly in improving our quality to make sure that we are correct the first time when we're entering the market. Selection of the business partner, working with a mindset which should not perhaps be an export mindset, but should actually be an MNC mindset, because as I said, export is undoubtedly, the most important thing which anyone can do for the country. But when you are in the export business, there is a lot of burden on your shoulders because you're representing your country in any country where you're operating. So you have to understand the local culture, in the best way possible. And perhaps, these are a few things which I believe, which made us, one of the largest exporters of CCL, and which made CCL one of the largest exporters from Pakistan, and we wish to continue and improve further. So thank you so much for this.
Thank you, Atif, and Nusrat sitting patiently at the end.
I thought you would start with me, but you didn't. Anyways, Assalamu alaikum and a very good afternoon to all of you. My name is Nusrat Munshi. I am the CEO and Managing Director of AGP Limited, which is a part of the OBS group, and it's the 10th, it's amongst the top 10 pharmaceutical groups in Pakistan. AGP is a 34-year-old company, and I'll just take a minute to share the journey which later on helped in developing our export markets. So during its early years, AGP partnered with global pharmaceutical powerhouses such as Eli Lilly, Alcon, UCB, Dr. Falk, and they were manufacturing their products locally under license. So that subjected AGP facilities to frequent audits by these companies, and which resulted in very strong quality management systems right from the beginning. The cephalosporins facility that we have, it was a purpose-built facility which was a joint venture with Eli Lilly, and it was made under the supervision of the technical team of Eli Lilly, so which helped us in the cephalosporins space globally when we showcased our products in the export market. Another factor which helps us, AGP is listed on the Pakistan Stock Exchange, so that gives us a lot of transparency and visibility in terms of our numbers, our top line, our various disclosures. So it certainly helps when we market our products to the export market. Just to give you an example, in 2022, our annual report was awarded the Best Corporate Report Award by the Institute of Chartered Accountants, which is testaments to our commitment to be transparent. So I think that's something which is unique when, as far as AGP is concerned. We started off a decade ago. We initially targeted territories with less stringent regulatory requirements to gain insights into the foreign territory, and later on expanded our arms. So that's pretty much, that's a little different. Our journey has been a little different from the others, I would say. So thank you very much.
Thank you, Nusrat. Thank you all for sharing your stories there. Right now I go into journalist mode because we are very, very short on time. We only have 12 minutes left. So I'm going to ask the questions. All I want is a one-sentence answer, please, so we can go straight down the line really quickly. And we'll start off with one. I know that Hamid wanted us to start off with this one. It's a very good question because Javed did a fantastic presentation dealing with this earlier. But I'm going to start with Haroon. I am going to start with Haroon. We'll start at the top. Give me in one sentence a factor stopping export potential for Pakistan's pharma exports. One of the factors.
One factor, and you said one line, and I think it's a mindset which blocks us, to explore the export markets. I think we should think outside the box, and there should not be any stopping the companies to explore the international markets.
Okay, Mujud?
Yeah, there is a huge potential for Pakistan pharma export. Only thing is, two things we need to do. One is the stringent regulatory requirements are changing every day. So as a pharma industry, we need to change our infrastructure and our R&D centers. In the other hand, we also need a support from the government. They must support us in terms of they help us to do a BE from some accreditation center with this subsidized cost. Because if you see Bangladesh government, the company is paying $20,000, rest the government is paying. Similarly, Indian government is paying 40% of the BE cost, whereas we are not getting anything. So for Pakistan, at the moment, the financial cost is a big challenge.
Okay, thank you. Hamid?
Thank you. I gave you this question to be asked, so I'll take more than a minute because I think this question, everything is in the answer of this question which you just asked. So according to myself, I believe there are 4 factors which are hampering the export potential, which the industry or the human resources already have it, but we're not able to exploit that potential. The first factor, I believe, is the industry itself, like the people sitting here or right there. Because I believe the kind of investment and the kind of reinvestment needed to improve our units are not being done. At least 50 companies in Pakistan, which are more than 10 billion, they should have invested a kind of amount required to get the international accreditations like US FDA, MHRA, EMA, or PICS certification. We have very few. So I think the first fault lies with the entrepreneurship and the people of the industry, that the kind of investment or the reinvestment needed to improve their plans to qualify for the international accreditation is not being done. The second thing which I believe is the depth of our regulatory The depth of regulatory is not as such to comply the international standards, or the time taken to develop a CTD dossier, apart from the cost, is not that quick as it should be. And that is directly related to the academia, third part. Academia, I say today, we have implemented CTD dossiers, we have implemented a lot of regulatory compliances, but the only product we are getting as a human resource is a pharmacist. A pharmacist who has no practical knowledge or no practical domain where he can go. If today if I ask what qualification a person I need to appoint as a QA, only pharmacist. As a regulatory officer, pharmacist. As a production officer, pharmacist. So no depth in the regulatory to fulfill the need of the pharma industry which is required. And last but not the least is the people who are in power, like DRAP or the Commerce Ministry or the Trade Development Authority of Pakistan. Two factors, like the processing time and the cost, that should be reduced. Anything that is related to the export, that should come up very fast and have very low cost to process the things in accordance with the international requirements. These four factors, I believe, are the main factors that we cannot exploit the full potential of exports.
Okay, thank you so much. Takio, what do you think?
I think we had been talking about lots of potential for export business, and over the years we are discussing that there is huge potential. And when we look at our neighboring country, India, which has crossed $25 billion export market. So in short, I would like to say that the triangle of industry, government, and the DRAP, these are the three major factors which, if they join hands together and take pharmaceutical industry as a lifeline to expand export. For example, there are 5 sectors: textile and carpets and other 5 factors. So pharmaceutical industry should be taken by the government as a new product to expand export and to bring revenue. So for that, I would like to say the only hindrance is that there should be a PharmExcel sort of committee here, and government should include industry and DRAP and all the relevant stakeholders, Ministry of Commerce, and we should take it as a project and should set a milestone that in next 5 years, from $300 million to we should reach at least in 3 years $1 billion export. And in order to do that, I think the government should provide friendly policies to expand export, and friendly and consistent. And CEO Asim Saab is sitting here. I think DRAP has also, we had lots of deliberation with DRAP, and they are all set to, because DRAP objective is now also to help and facilitate pharmaceutical industry to expand export. So I think if all these three, DRAP, government, and industry is ready, potential is there. So I think let's request government and DRAP, and we should also realize that lots of potential is there in export. So if all these three factors combine together, set an objective and work continuously and at a faster pace, I am sure that Pakistan can be seen as one of the major exporters in this area.
Okay, thank you. Arshad, what do you think? What are the factors stopping export potential?
Thank you very much. You already have said, go like tuck, tuck, tuck. Already I have taken a lot of time. I would like to just suggest 3 factors. Government of Pakistan should take it as a challenge and make some pharma export committee, and that should be given target of export, and that target should be regularly followed by the Prime Minister of Pakistan. And as pharma export cannot be possible without the help of a regulatory authority. So I would like to request CEO DRAP, Assam Rauf Sahab. I need really real help for export from DRAP. If that help actually been given to us, our export can be double, tripled anytime. So the third factor, that is quality. Every industrialist should invest on his plant to cater better markets and to ensure quality of the product. So investment on the plant and the focus, clear focus, we are going in export market, that should be there. Focus, focus, and focus. Thank you very much.
Thank you very much. Might be a repetition what has already been said. In my opinion, one thing is focusing and understanding about the global regulatory compliance is and would be the key. And second thing, exports should be the collective objective of all the stakeholders, be it Ministry of Health or Ministry of Commerce or Ministry of Foreign Affairs or Pakistan pharmaceutical industry and the company. So these are the two things. Thank you.
Thank you. Correct?
Yes. One most important thing, to invest in your companies to build their standards. So we meet with the international standards. We have been through MHRA and EU GMP because our equipment, our machinery is, you see, a Mercedes of pharmaceutical industry. So we have to improve our standard to have CFR compliant equipment in QC, testing, everything, and buying raw material from a good source and doing risk management analysis before we enter into any stringent export market. Thank you.
Atif?
I think quality is a given in any case, because in the industry in which we are, pharmaceuticals, that's a given. Yes, we need to evolve further wherever we are. However, perhaps I believe that this is the time for incremental innovation. Simple innovation may not, because by and large, we as a country operates in branded generic pharmaceutical business. So to get into, to be perceived as a country where some incremental innovation can happen, for example, high-value generics, for example, biosimilars, this can perhaps, be the game changer, because, what we notice in the world out, wherever we operate now, especially in the so-called emerging and developed markets, this is what the game changer would be. So that's my 2 cents on it.
Okay. Thank you. Nusrat?
Okay, so my 2 cents are that I think as a nation, we are often stuck in the lowest grade of the Maslow's hierarchy of needs, which stops us from doing better. Now, I'll just a couple of points. I think DRAP's accreditation, if that could be uplifted, I think all companies under the purview of DRAP would get a natural uplift. Secondly, I think it's a good forum, and this is something which is very close to my heart, is the counterfeit problem in Pakistan. I think that zaps out a lot of energy from quality manufacturers. The counterfeit rate in Pakistan, based on a WHO study done in 2011, it's between 40 and 50%. So in terms of commercial interest, that hurts the commercial interests of companies, quality manufacturers. So I think if that is addressed, that would leave a lot of resources to good quality manufacturers to invest into exports.
Thank you so much. My next question to all of you, there's obviously a huge global discussion on sustainability, environmental friendliness, moving away from traditional testing practices. And we've heard some of our speakers this morning talk about, affordability, price points, making things available to everyone. So my next question to you all is, how do you ensure sustainability and ethical practices throughout your supply chain? Haroon, if I can start with you just for a quick answer.
I think supply chain in the last few years due to COVID has been a significant challenge. And the pharmaceutical industry is very transparent in the sense that, anything we buy, any raw material or any packaging material, has to go through a rigorous process of quality control. So I think over the last many years and with the regulatory standards which are becoming very stringent, especially as we talk about the local regulatory compliance, you know, the regulatory authority have come up with many of the challenges that we are in the global context. So the supply chain is coming in a very transparent, and I think over the years we will see a lot of companies will have to, you know, as my colleagues talked about, data integrity. I think data integrity as a global context is playing a very important role, and everything you do in the pharmaceutical industry has to be a solution where integrity is no doubt and the quality is paramount. So I think the sustainability is there, the environment and the quality and the supply chain, I think will facilitate the pharmaceutical industry, especially the compliant companies, to grow further into their businesses.
Thank you. Majood, how are you dealing with this within your organization?
Yeah, actually, you know, supply chain is one of the key factors for any organization. In normal circumstances, the supply chain obviously is very important. Like before COVID, we were doing very good. We have full supply chain system, SAP system, and our planning team is very equipped with all the software, everything. But after COVID, then, you know, the economic condition of the Pakistan, when imports were delayed something, and during that period, supply chain disturbed a lot. Otherwise, I believe the supply chain very important. Only thing is both your distributor and as your supplier, if you are, set a protocol, SOPs to maintain the inventory, including the transit time, then, you are good to supply the stocks and avoid the shortages.
Okay. Hamid, how are you dealing with sustainability in your organization?
As my colleague said, the supply chain is very critical in sustaining or maintaining the quality of any product. So you need to see that if you can build the facilities in-house, or you can delegate to some competent companies who can manage it for you, for your raw materials and finished products. And for your inventory in your company, you have to make enough arrangements from the inception of the raw materials till the execution of the final product, that all the conditions are maintained to sustain the quality of the product. Thank you.
Thank you. Takir?
Yeah, I think supply chain is key to success, and the first important thing is that we should be having a very, very professional partners in terms of supply chain, because 95% of our raw material is imported. So we have to select the quality partners, and they should be able to supply. Recently, we faced lots of issues, and the companies which were not having a professional supply chain partners, they really face issue. And I would just quickly quote an example that last year, Sri Lanka went into default, and there was huge shortages of even multinational companies because LCs were not opening, and raw material source was also an issue. So as a company, we became very active, and we were able to procure raw materials right before time, and we were able to supply our products in that unpredictable and unprecedented situation, because there was acute shortages of eye care products in Sri Lanka, and we were the only company which was able to make sure that our products are available. So it helped patient, medical community was happy, and we also got this opportunity to utilize this unprecedented situation into an opportunity to build our brand. So I think supply chain, most of the companies have gone into SAP, and that will bring efficiency. So I think we should also ensure that efficiency of supply chain is very, very important.
Okay. Thank you. Arshad, very quickly, please, because I've been told time. So.
Thank you very much. As Takir Bhai said, in the recent global economy, there are many challenges, like dollar is unpredictable, or inflation is unpredictable in international business. When you decide some rates with the other partner, definitely you have to provide stock on the same rate. For that purpose, you have to maintain a minimum inventory level. For that purpose, what we are doing, we are maintaining a certain level of inventory of all those products. just to avoid if dollar rate is changed, that should not affect our supply chain. So whenever you decide some rate in international market, you must have inventory of those products on the same dollar rate that is today or the same day. Thank you very much.
Thank you. Adil?
Thank you. I agree with Harun Qasim in the kind of regulatory structure we have in Pakistan and the compliance we follow. Supply chain has been remained very transparent by default. So there's no question about this thing. The pressure which we faced during last, especially last 2-3 years because of economy is the devaluation of PKR. So this is the pressure which we faced, not in any other kind of a pressure. Thank you.
Correct?
Yeah, it is very interesting and very important. Our transportation and the way we portray our products, how we palletize our product, how we place the data loggers, how we switch the refrigerated container at our premises and then on way to Karachi. So all these things are to be monitored till every level. And we by self make sure and we take pictures. So if a custom authority or, these things in Europe, they don't like the packages to be opened by anyone other than themselves. So it is very important and you have to wait till the container reaches to the destination and they are satisfied with the temperature controls and other parameters during the transportation. So we ourselves make sure that they receive the product as we send the picture to them. Thank you.
Thank you. Atif?
Emma, perhaps when it comes to sustainability, if that's where you started the question with, sustainability is very close to CCL's heart. Perhaps of the so-called published SDGs of WHO, which are, I believe, 17 in all, in number, the two which we have decided to keep, and started working upon is climate change and perhaps health and well-being. And, in order to make sure that we work or we add value in terms of, I feel very proud that CCL among the pharmaceutical companies, is one of the pioneers who have taken the lead there. And there is a special focus. There are ambassadors within the organization, where we make sure that at least of the 17, these two SDGs are being special focused upon, and then there are various activities which revolves around all this. So that's our part in that.
Thank you so much. And Nusrat, I know sustainability is something you're passionate about.
Yes. In fact, out of the 17 SDGs, we implement 9 at AGP. We are proud to, and its details are there in the annual report. Just on the other side, I think a good, fully integrated ERP system is extremely important for an efficient supply chain. And AGP was one of the first companies 16 years ago to implement SAP, a fully integrated SAP. And I think over the years it has paid dividends because it helps us making informed decisions. So I think that's extremely important as well.
Wonderful. Thank you so much. Well, all I can say is the industry in Pakistan is in very good hands with all of you. You're the future. You're making it work and looking forward to seeing what you do next. Please, can we have a nice round of applause for our panelists?
Extremely thankful to the distinguished panelists. I'm sorry for intervening here. So we will not have the group photograph and the plaque distribution ceremony because we have to vacate this hall at the instructions of the Prime Minister's office at 1 p.m. And we have 2 distinguished speakers who will be speaking after this panel. The first speaker will be Honorable Chief Executive of TDAP, Zubair Mutiwala Sahab, and after him, Dr. Asim, the Chief Executive of DRAP, will also be speaking for 10 minutes each. At 1 p.m. sharp, we will leave this premises, and we'll all have to go out, just right adjacent to the main building. And there is the setup by the security detail because Prime Minister is arriving here at 3 p.m. So as you know, the normal protocol is that you have to deposit your mobile phones and you have to have your national ID cards with you. Most of you have given us your ID cards, which have been provided to the agencies, and so we'll try to make it as smooth as possible. I think it's going to take 25 to 30 minutes for people to get screened and come back to the main hotel lobby, where lunch will be served and it will be ready, and you will enjoy your meals. And in the meantime, this hall will remain under the supervision of the security agencies, and whoever enters and walks through the screening toward the lunch area will be free to move about, of course, after depositing the mobile phones. So, profound apologies. Distinguished panelists, please, you may take your seats. And we are proceeding with our program. Zubair Motiwala Sahab is requested to please come on stage and please speak for 10 minutes. Thank you.
Bismillah ar-Rahman ar-Rahim. The Bukhari Sahab, the chairman of PPMA, distinguished and very top-line manufacturers of pharma products in Pakistan, members of PPMA. At the outset, I would just say that I congratulate the association for conducting this 6th summit of pharma. I think that's the way how the things should move. And while I was here listening to the speeches and listening to the conversation of the so many very learned people from the pharma sector, I think that pharma is a sector for Pakistan which we see as a progressing sector. But of course, there are so many problems and possibilities. But if you look at, I was just looking at numbers and the figures of exports. They're encouraging from last year to this year. You have improved by about 24%, which is about $66 million. That is, but overall, looking at the Pakistan's potential of 336 million last year, it's very low a number compared to our neighboring country, India, which is $24.6 billion. So if we even, let's say, 10 times higher large economy, then we should be at $2.5 billion, not at $336 million. So this is where I think that what lacks in Pakistan, what are the problems in Pakistan, why we are not progressing, what are the problems which are actually hampering the growth of the pharma sector in Pakistan, and why we are unable to penetrate to those markets which are there, which are the virgin markets which are available to Pakistan. That is Africa and cars are the two markets which Pakistan can really penetrate into. And then there are sub-Saharan countries and so many other. And those who have gone into US and EU markets, they need to be saluted. They've done a wonderful job for themselves. But what I want to say from as a CEO of TDAP is that we have actually bifurcated the TDAP's working. We have divided into sectors. There's a different sector for textiles, for pharma, for leather, for agriculture produce, for light engineering. We've got different DGs now who are working on this direction. We have continuous interaction and webinars on every and any subject. We have got, I mean, if you count on them, there are hundreds of webinars are going on. And for the pharma sector also, we are doing the same as we continue to support any sector which we feel that it is, it has got some strength where we can increase the exports of Pakistan. For pharma sectors, we are exhibiting and we are taking part, we are participating in almost all international fairs for Pakistan. We're taking pharma people and, from here, we've been to Kenya, we have been to, we are participating this year to Africa Health,
Arab Health Dubai, Expo Med Turkey, and Medical and Dental Expo Morocco, and Global Health Saudi Arabia. These are the plans for the next year which we're doing it, that people should come up with us. We will participate in a way that we are a national, as a national team, we will participate with the Pharma. And Pharma, I believe, can do wonders. And what I was listening is that we are there. And one biggest thing which I want to share with you, you might not be knowing, that we have set up a web portal, Trade Portal Pakistan. It's a kind of an Alibaba sort of a thing, where you can display your products. You can display that, and there'll be no charges for this. It's a free of charge, you can display, and it is all over the world. And this trade portal is like Alibaba, that once you interact with your buyer, somebody's, let's say somebody's asking you, somebody's inquiring you about, somebody's hit your product, and then you and the producer and the buyer are on one page and interacting with each other. It's not necessary that you have to go through there are secrecy and all those problems. We have maintained that. Visit that web portal, Trade Portal Pakistan, and display your products there. I think that you'll have a lot of market through that, because anybody who's looking for Pakistani pharma or Pakistani products, he will definitely come to Trade Portal Pakistan. So that's what we have actually initiated this time. And for participation in fairs, come, we are there. If you will indicate that these things are a problem. One more thing we are working in is that we have come across that in African countries, the registration of the drugs is a problem. And that Indian lobby is so strong that you people are unable to penetrate and get registration of the same product for which India has got the registration. So I think that we are working that directions. We have got TIOs in 54 countries. Trade and investment officers are there. They work under the TDAP instructions, and we are there. If you've got any problem in getting registration in those countries, I think we can help you out. That is also a biggest problem and biggest challenge, where you go and get yourself register. And in Pakistan, and there are so many other problems which I really want to discuss about the pharma industry, but because of positive time I would like to limit. But my first thing is that pharma industry needs to have continuous BMR policy, that is balancing modernization and replacement. That is the key word, which I've studied the pharma industries the world over. The continuous balancing and modernization is being made. I think that is the key to the success. You have to have R&D, a strong R&D, and BMR. This is the key word for progress of pharma industries in Pakistan. That's where we want to look into it. Wherever we can support, we are there to support you. And about the exports and refrigerated cargo and I think the transportation and shipments are concerned, I think there are very, very valid points which will take it to the government of Pakistan, and we will see that it is we do something about it. Now, coming to the prices in Pakistan, coming to the shortage of life-saving drugs and drugs in Pakistan, yes, we understand that the dollar-rupee parity has gone up. It is about now 100% compared to last 2 years, the increase is there. Similarly, the prices have not increased, because your 80% of your components are imported, raw materials are there, so that similar price, but we cannot do it because the economy of Pakistan is not such. My request to all of you is that reduce your profits, because you have earned a lot from Pakistan. So this is the time where you should pay back, and prices would definitely increase with the kind of economy we're increasing. You would be pleased to, you have already heard the news of IMF signed agreement with Pakistan, and then yesterday we had a good news that Saudi Arabia has deposited about $2 billion in State Bank of Pakistan already. So these two things are positive things. UAE would be coming in, China would be coming in a big way. We are in a process of, I think, revival of these 2, 3 years, 4 years problematic situation back to normal, and then, to strategic growth, which we are all looking at. So all these things which are there, the industry pharma has the potential. You have kept yourself a target of $1 billion. I think it's very modest, which you have said. I think the target should not be less than $2.5 billion as the neighboring countries there. So I think that 2.5 billion should be not a big target for all of you. And one more thing which I want to, my secretary TDAP is sitting here, that as everybody was saying, that we should try and get new investors in the pharma industry. That what I've learned from today's all these things, that you people are so helpful to each other. There is no, it doesn't seem that very you are competitors among yourselves there. You actually, you are trying to help and operate and also promote the newcomers. So that newcomers new blood needs to be put into the pharma industry. That we will try and see that what we can do about it. And somebody said that 5 zero-rated sectors are there, where textile, carpet, surgical goods, sports goods, and they are pampered or they are looked after by the government of Pakistan. But their export is what? The export of these 5 sectors is 70% of the total exports of Pakistan. So that's what it is. But if pharma is progressing, like from last year to this year, it is about 24%. It's very, very, in percentage terms, it looks to be a very good figure which you have achieved. So I think this sector, I will try that we talk to the government of Pakistan that a special attention should be given to the pharma. And the hurdles of getting registration in Pakistan or the others is also a big problem. Supply chain is a problem, and I've understood so many other things. The regulatory framework needs to be streamlined. That also needs to be understood. But I can pledge on this, standing on this podium, that TDAP, Trade Development Authority of Pakistan, means business. We have come and we have actually brought radical change into the system, and the Trade Development Authority would be there to help you. Send your people. We've also initiated one program where how to export is our initiative then. How to export. If somebody is a newcomer, he doesn't know how to export, we would be there to help you out. We would be there to arrange your meetings with the foreign buyers. We would arrange to see that your products are marketed, and marketing techniques, we would teach those techniques. And we are there. Come forward. Come to Trade Development Authority, and we will be there not only just to answer you, but we would be practically helping you how to get the market you're looking at. But at this point in time, I want to address the multinational companies which are here in Pakistan. I want to tell them, trust Pakistan. You have been here for a long time, and you have earned a lot from this country. These are trying and testing times. We are passing through the worst of the economic crisis in Pakistan. But at this point in time, we need your help. And I've heard that some people are, they're trying to pack up. Please don't do that, because Pakistan is there to stay. And understand that this potential of the Pakistan is too huge. And with the population of 220 million people, you cannot go wrong. So come to Pakistan. The multinational who have not come to Pakistan, come and invest in Pakistan. We are here to help you in any terms and manner. We would help you all the way, but you don't, please understand that Pakistan needs you at this point in time. Our economic problems would be over, and inshallah, we will be on the track of prosperity. And I see that there is no reason that with the kind of a population we have, with the kind of entrepreneurship skills we have, I think Pakistan would prosper, would grow to a level which we all want to see. We all want to see Pakistan a very productive, progressive, and pragmatic Pakistan. That's all we all want to see, and you are part of it. Pharma is an important sector for the government of Pakistan, and we would definitely help you in whatever manner and fashion you are looking at. We would see that your hurdles are taken care of, your progress which you want to do, the machineries which you are importing from Pakistan. The opening of LC, which was a problem, is now come to an end, and inshallah from today or from the Monday, you will have a streamlined and very smooth system. We are meeting State Bank of Pakistan on tomorrow, tomorrow evening. So we'll be settling so many issues. And those whose containers were left there on the port, we are sorry about it. I think this should not have happened. Then the essentials were opened. Today also, the essentials, which is pharmaceutical products and the raw material of the pharmaceutical comes on the top of it. They are not having any hurdles. But if you have any hurdles, please come to TDAP. We'll try to help you. And I'm once again, thank you very much for inviting me here. It was a very learning curve for me about the pharma industry. And I belong to textile sector, but I think that pharma is a good business. We should also, our group should also understand and go into this. So thank you very much, ladies and gentlemen. Thank you very much.
Thank you so much, Zubair Mamatiwala, CEO, Trade Development Authority of Pakistan. Up next, I would like to invite for a very brief speech, CEO of DRAP, Dr. Asim Rauf. Dr. Asim, would you like to come up, please?
Bismillahirrahmanirrahim. I can understand the paucity of time, as I have been told that it's just 3 minutes left. I would try to be very brief, keeping in view the arrival of the Prime Minister of Pakistan. Honorable Zubair Saab, the honorable guests, and everybody sitting here in the hall. You know, the export is a dream, not only for the DRAP, but also for the Pakistan. Recently in this year, we have witnessed a surge of, I would say the therapeutic goods export has risen to $713 million. And our target is $1 billion for this year. But I want to let you know, without getting international accreditations, without getting the WHO pre-qualifications, without getting the FDA approvals, without getting SPIC certification, both by pharma industry and DRAP, this would not be possible. So that's why DRAP has reformed itself, is on the process of evolving and reformation. We have completely e-governance deployed in DRAP. We have deployed various automated systems for transparency, visibility, and traceability. And our pharma industry has come forward, and at the moment, at least 8 or 9 pharmaceutical firms, they have got international accreditations. The journey from 0 to 1 billion is hard, but the journey from 1 to 5 billion would be easy, inshallah. Our target, as Zubair Saab said, should be 2.5, but I keep in mind always, it should be around $5 billion. So stand we united with pharma, all the stakeholders, DRAP, government, to excel in export of pharmaceuticals. Last point, our strategy should be to enter into the most stringent market, the most stringent regulated market, and that is North America and Europe. Without entering into those markets, we would be just, continuing with comparing with our neighbors. So our target should be to enter into the most regulated market. I wish you best of luck, and I want to let you know that DRAP is with you and with the government of Pakistan to achieve our export targets. Thank you very much.
Thank you so much, Dr. Asim. And finally, before we break at 1 o'clock, I would just like to invite Secretary, Trade Development Authority of Pakistan, Fareed Iqbal Qureshi, to come up to just say a few words. Thank you.
2 minutes? All right.
Bismillahirrahmanirrahim. Honorable Zubair Motiwala Saab, Chief Executive of the Trade Development Authority of Pakistan, Dr. Rauf, CEO DRAP, Mr. Farooq Bukhari, President of the Farmers Manufacturers Association, respected guests, participants, Assalamu alaikum. Wow, so I'm going to have to be quick. I think I hardly have like 1.5 minutes left now. So actually, I think the most important thing has been said by Mr. Motiwala. And I felt it right from the beginning when I saw the first presentation by the gentleman from Art and Dow. The export screen did not have any mention of either TDAP or the assistance that could be provided. And then in the success stories, I noticed that we need to actually re-engage very forcefully. TDAP is there, like Mr. Motiwala mentioned. So I think we look forward. There is actually, somebody mentioned this Pharma, I think, which is a sector export council in India. We have a sectoral council which has been notified 2 years back. The head of that was the ex-chairman of PPMA, and unfortunately, I am having to, say this. So I think there is this gap which we need to bridge quickly. And to meet all the, and to, create that momentum going forward so that we can, inject some urgency and some effort into this entire export-related drive that we've all spoken about, and we are all we understand that it's probably the most important thing which we need to do. So we look forward to meeting you. We are based in Karachi, and I'm sure the association is also there. And, the first opportunity in the next few days or next week when you have it, I think we need to meet up quickly so that we can exchange notes and, plan or chart a way, going forward. So thank you very much. It was a pleasure being here in this short time. I don't want to take up any more time. And thank you very much for the invitation, please. Thank you.
Just stay on the stage for me. That'd be great. Thank you so much to Fareed. Thank you, gentlemen, for your wonderful talks. And now we'd like to present you with some mementos. So if I could please ask the lovely Saeed Farooq Bukhari to come up and give those out for me, that would be wonderful. And we have the first one is for Zubair Motiwala. And of course, we have one for Dr. Asim as well, and we have one for Fareed Iqbal Qureshi. Thank you so much, gentlemen.
Distinguished guests, ladies and gentlemen. So we've been able to, coordinate with the PM office, and now there is a good change in the program. We will be having lunch right after 5 minutes, and after lunch, then we'll all vacate the premises, and get the clearance from the outside. So first we'll have the lunch. So lunch will be served in 5 minutes. You can stay here because lunch will take 5 minutes to get prepared. Thank you for your patience. In the meantime, audio-visual team, can you play some commercials of our esteemed sponsors and the conference promo video? Thank you.
Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP.
Thank you so much. We shall now have a recitation from the Quran.
بسم الله الرحمن الرحيم إذا جاء نصر الله والفتح ورأيت الناس يدخلون في دين الله أفواجا فسبح بحمد ربك واستغفره إنه كان توابا
Good afternoon, ladies and gentlemen, and welcome back to the Pharma Export Summit and Awards 2023. We would like to extend a huge gratitude of thanks, and it's a great honor to have His Excellency Mian Mohammed Shahbaz Sharif, Prime Minister of the Islamic Republic of Pakistan, here with us today. And also joining us on stage, we have, of course, Chairman of PPMA, Mr. Syed Farouk Bukhari. We also have Ministers, Mr. Makhdoom Murtaza Mahmood, Federal Minister of Industries, Dr. Musaddiq Malik, Minister of State and Minister of Energy. We also have Senior Vice President of PPMA, Mr. Nadeem Zafar, Chairman of Conference Committee, Dr. Sheikh Kaiser Wahed, and co-chair Conference Committee Harun Qasim, who is going to assist me up here this afternoon. So thank you so much. And to begin proceedings this afternoon, we'd like to welcome, please, Syed Farouk Bukhari, Chair of PPMA, to come up and give an opening speech.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, ladies, gentlemen, diplomats, distinguished guests, excellency, and dignitary. And thank you. Our industry is thankful to our chief guest, His Excellency Honorable Prime Minister Mian Shahbaz Sharif, Saab, for assuring his unwavering support for exports of Pakistan and uplifting our country by his presence. I would like to take this opportunity to thank you personally and from our pharma industry for your kind support since inception as our leader, by creating a special committee addressing our impediments of pharma industry under the chair of Honorable Finance Minister Ishaq Dar Saab. And it goes without saying that you and your team, sir, has averted an economic meltdown and saved our industry. For what we appreciate and extend our support to you and your competent colleagues for our full support to uplift Pakistan economies and the fabric of our society. सर अल्हम्दुलिल्लाह जो इस स्टेज पे हम खड़े हैं वो माशाल्लाह आपकी सपोर्ट की वजह से खड़े हैं. Last year this industry was on a collapse, verge of collapse. You have saved it, and thank you very much once again, sir. Again, sir, I would like to take this opportunity in presence of our honorable chief guest, His Excellency. Although, sir, there are various repetitions for export growth in pharma sector, I would like to highlight and touch upon three most centric ones, which require urgent and mutual positive intervention and implementation only a strong will and swiftness such as yours, Your Excellency, would be able to attain. Firstly, so the economic aspect of pharmaceutical industry should be disintegrated from its regulation dimension, particularly Section 12 of our drug policy. Economic aspect, which entails exports and producing distinct products, comprehensively prices of essential drugs listed by WHO, and of course, essential drugs which are to be made available in our BHU, basic health units, and DHU, should come under drug pricing control mechanism, and the rest should be left to the market forces, where it would allow healthy competition and fair price of quality drugs, and inherently will curtail shortages of drug, which has been concurrent subject of this industry in the face of adverse or force majeure cost increase or other external factors by our economy. So this is the model that led to growth of our neighboring countries, namely India and Bangladesh. So having said that, at the same time, simultaneously, while enabling DRAP to become a catalyst of growth, propelling its effort towards inspection, registration, licensing, and monitoring quality. Pricing and economic aspect creates conflict of interest in core functions of DRAP. It would be unfair to mention DRAP has been actively engaging in creating an enabling environment that fosters growth for encouraging innovation, promote R&D, and facilitate the export of high-quality medicine to international market. But of course, its economic function becomes its shackles to thrust the industry itself completely to a high-end quality export accredited facilities recognized by international accreditation authorities. But nonetheless, given these all adverse situations for us, we are proud to say that few of our companies, namely Pharma Evo, Remington Pharma, and one Guess Pharma are WHO recognized now. One is MHRA, one is Canadian recognized, and two are PICS recognized. Your Excellency, if DRAP is allowed to function on its true purpose of ensuring availability of quality and essential drugs in the market, believe me, you and me, that will serve the purpose of the industry and the national interest itself. So secondly, I would like to mention here that our neighboring country had allowed and envisaged SAME and Pharma Excel was created, which sole purpose is what we are pleading right now to Your Excellency. Although on the persuasion of the pharma industry, there was a council that was created by namely Pharma Council. Sir, here I humbly request you if that could be again reactivated in your presence, sir. Moreover, sir, given it is pertinent to mention that against all odds, as you've seen, the whole export of Pakistan has probably taken a downshift. But nonetheless, we are proud to say this, that pharma export has performed 25% above year-on-year from the preceding year. Having said that, we have almost reached a 700 million mark of therapeutic goods, and today we have pledged ourselves that inshallah we will take this to a $5 billion mark. Given your personal support and the way you have supported this industry continues, and of course the implication that we are mentioning could be resolved as well. And moreover, sir, and again a humble request to Your Excellency, that we have listed 5 top pharma export companies, export industries, sectors. Unfortunately, pharmaceutical sector has been neglected. I would take an example of $75 million of carpet industry, which is a meager 75 million. Only one of our colleagues has almost more than $100 million export. Nonetheless, it is neglected industry, so I would like Your Excellency to give a derivative to the authorities to actually allow us to become a priority export sector. So lastly, I would draw your attention towards the fact the pharma industry has been paying 1% in form of CRF, Central Research Fund, which has been given to Health Ministry and latter DRAP for many years. The funds have accumulated in this account in quantifiably in billions. And we urge they should be utilized wholly and solely for the purpose of research, development, and export development by facilitation, accreditation, and form a function body with pharma industry stakeholders for the dispensation of these funds. Moreover, sir, I believe Janzeb Khan Saab is present here. We've been in touch with him. We had some good talks, discussion, deliberation on the matter. He's well aware of all the trepidation and amendments this has. So I would allow if you could give him the task to take up this matter, and we can work towards a research institute that allows not just our industry, but the general public in large get the quality medicine that they deserve. Once again, sir, I thank you for your presence. And once more, sir, again, I would like to say this, a round of applause for His Excellency, the way he has formed that committee, special committee just for us. And that committee was solely focused and given a task of saving the industry, which was actually on the verge of collapse. But nonetheless, his undying faith towards this country has helped us, allowed us, कि सर हम आज यहाँ खड़े हैं, आपकी policies और आपकी unwavering support की वजह से खड़े हैं. Once again, thank you, Excellency, and I thank Minister Saab, Mr. Malik Saab, Mr. Industry Saab, and Senior Vice Chairman Janzeb Khan Saab, Secretary Commerce, Secretary BIA, and I would also like to highlight the presence of USP, United States Pharmacopoeia, in this hall. And of course, Zubair Motiwala Saab, CE TDAB. Thank you, sir.
Once again, we thank you for your presence today, Prime Minister. It's a complete privilege to have you here, and now we look forward to a few words from you.
Bismillahirrahmanirrahim. Honorable Ministers, Syed Farooq Bukhari Chairman, PPMA, Mr. Nadeem Safar, Vice President, Dr. Sheikh Kaisar Waheed, Chairman, Conference Committee, Mr. Harun Qasim, Co-Chairman, and our prominent business members from pharma industry. Ladies and gentlemen, Assalamu alaikum and a very good afternoon. Let me at the outset pay my heartfelt tributes to your efforts, your ingenuity, and your commitment to promote pharma industry and transform into one of the most going export industry in Pakistan. Your quality of your products is, alhamdulillah, established and beyond any ray of doubt, and you have earned a great name in this field. So I would like to offer my deep gratitude and heartfelt Mubarakbad to all of you on behalf of the government of Pakistan, myself, because you are great ambassadors of Pakistan who have earned a great name. Now the point at issue is that it is a matter of, not a matter of debate, but a matter of commitment on your part, on the part of any government of the day, to protect the poor of this country in terms of pricing formula for life-saving drugs. And now there is inherent contradiction, and I appreciate that because of a rising trend of inputs, their cost, the prices, obviously, cost of production has gone up, and it has a direct confrontation with the protection of the poor in this country in terms of important life-saving drugs. But that does not mean that the government of the day should ignore your pressing demands and valid challenges. Government of the day has to obviously protect the poor on one hand and also ensure that the industry is in a stable condition and does not suffer for undue delays in terms of decision making. That is one of the main reasons I constituted this committee. And this committee had extensive discussions with you. Some of you sitting here met me individually and collectively. And I'm very grateful to my team, Finance Minister Ishaq Dar, Health Minister, Commerce Minister, and Minister for Industries and others, to have resolved this issue to a large extent. But the point at issue is that we are gathered here not to make speeches, but to do something cogent, palpable, to support your great efforts, and in a manner which should promote and support your efforts, and also protect the needy and the helpless. May I also recount and recollect from my memory a couple of instances which you are very well aware. Back in 2016, when I was serving as the Khadim of Punjab, I had decided, and you know it very well, to procure medicines for government hospitals. And I made a public statement that the quality of the medicine would be which can be easily accepted by the highest office bearer of the country down to the common man. And for that, I had dedicated roughly about 7-8 billion rupees for procurement. You are well aware. We went for a very transparent procurement mechanism, and companies were pre-qualified, obviously, because we didn't want spoilers to spoil the entire effort. And as a result of that, there was hue and cry, I know. But as a result of that, we were able to select 16, 18, 20 companies. This is my memory, I hope I'm not wrong. And then, ladies and gentlemen, we went for this bidding process. And then those companies who had qualified for those procurements, their samples were sent abroad, as well as यहाँ की lab का क्या नाम है जो फेडरल गवर्नमेंट में होती है? उसका वो abbreviation क्या है उसका? No. There's a testing laboratory, but there's an abbreviation for this. Drug testing laboratory, something like that. And I concede that at that point in time, we had a few labs in Punjab which were up to the mark, but most of others were redundant or not, efficient to come up to the level of people's expectation. Now, here is the story. We sent those samples to this federal lab, the ones in Punjab, and then you know it very well. It's an open secret. It's not something which you are not aware of. And then samples to Britain and France and some other countries. 90% or more than 90% of the lab reports in Pakistan were all okay. And the lab reports from abroad were about 40% okay. Or 50%, I don't remember, but this was the figure I remember. There was obviously huge hue and cry, and the companies who are very well known, mashallah, you're sitting here and you are doing a great, fantastic job, no doubt about it. But this was a fact. And then we established our own labs in Punjab of state of the art, you know it very well, at Lahore, then I think at Multan, and some other place, Faisalabad, thank you, and other places. Next year, when we made this procurement, and reports were, samples were sent to labs, Europe and other countries, and these labs in Punjab. Alhamdulillah, I'm telling you, reports, samples had exactly the same report as international reports. So I salute your hard work. I salute your wonderful contribution, and those labs which were established in consultation with a British company. I remember I visited their head office in London as well, out of London. I think the State Secretary was speaking in American accent, and my honorable chairman of this association was also speaking English. But please allow me to speak in Urdu now. तो मैं आपको, sorry, I hope you understand Urdu very well. They will translate to you later on. तो मैं कह ये रहा था कि बाखुदा आप बड़े زبردست پاکستانی ہیں اور آپ نے بہت ملک کا نام بنایا آپ نے، لیکن جو مشکلات ہیں، جو چیلنجز ہیں، ان کو ہم نے مل کر اس کو حل کرنا ہے۔ میں کبھی یہ نہیں کہوں گا کہ آپ منافع چھوڑ دیں اور نقصان کر کے، یہ سوال نہیں پیدا ہوتا، کاروبار اس طرح چلتا نہیں ہے۔ آپ پروفٹس کمائیں، جو آپ کا حق ہے وہ آپ رسک لیتے ہیں، یو آر گریٹ انٹرپرینورز۔ بینک سے آج کل جو ریٹ ہے وہ بھی 19-20% ہے یا 22% ہے، جی 22% ہے، جو کہ اٹس اے کلر۔ انشاءاللہ وقت آئے گا کہ یہ پالیسی ریٹس کم ہوں گے انشاءاللہ۔ آج رات کو IMF کا بورڈ کی میٹنگ ہو رہی ہے، خدا کرے گا انشاءاللہ اس میں ہمارا پروگرام اپروو ہوگا، آپ کی جو LCs ہیں اور کھل سکیں گی، ہمارے ریزروز بڑھیں گے۔ لیکن دس از جسٹ دا بگننگ آف اے لانگ جرنی، جس میں بڑی ہارڈشپس آنی ہیں، بڑی مشکلات آنی ہیں۔ اس میں ہم دونوں نے، جو بھی حکومت وقت ہوگی، سیاستدانوں نے، کاروباری حضرات نے، آپ نے اور ملک کے تمام اداروں نے مل کر اس ملک کو بنانا ہے۔ اس کے لیے میں آپ کی بات میں نے بڑے غور سے سنی ہے۔ میں ایک کمیٹی آج بھی بنانے کو تیار ہوں، تاکہ جو آپ کا جو ایکسپورٹ کا جو پوٹینشیل ہے اس کو ہم کس طرح اور اس کو بڑھائیں، اس کو ایکسپینڈ کریں۔ آپ کے جو جینون جو آپ کے چیلنجز ہیں ان کو ہم کس طرح حل کریں۔ لیکن انگریزی میں وہ کہتے ہیں اٹ ٹیکس ٹو ٹو ٹینگو۔ حضرت مولانا بیٹھے ہیں، میں دوسرا کہہ دیتا ہوں کہ تالی دو ہاتھوں سے بجتی ہے۔ تو میں یہ سمجھتا ہوں کہ آپ اگر بڑی ارک ریزی سے بیٹھ کر حکومت کے ساتھ ان معاملات کو ڈسکس کریں، میں آپ کو یقین دلاتا ہوں جو آپ نے مطالبات پیش کیے ہیں، انشاءاللہ ہماری حکومت کی آئینی مدت ختم ہونے سے بہت پہلے ہم یہ معاملات حل کر لیں گے، اور آپ کو ہم یہ انشاءاللہ ضرور۔ لیکن اس میں آپ کو بھی بڑھنا ہوگا۔ میں جب پیرس میں ملا IMF کی MD کو، تو اس نے کہا کہ پرائم منسٹر there is a big gap between our asks and what you are prepared to undertake those steps. تو میں نے کہا کہ yes, we are going to step forward and try to come to a meeting point. لیکن آپ بھی اس میں آگے بڑھیں۔ اس نے کہا پہلے تو اس نے کہا یہ ہو نہیں سکتا، فلاں لمبی بات تھی، لیکن بعد میں جب برف پگھلی تو الحمدللہ معاملہ سلجھے، اور پھر دیکھا۔ میں آپ کو بڑے خلوص دل سے بتا رہا ہوں کہ اس پروگرام میں یہ کوئی مٹھائی بانٹنے کا یہ موقع نہیں ہے۔ آپ جانتے ہیں IMF کی جو کنڈیشنلٹیز ہیں وہ جکڑ کے رکھا ہوا ہے ہماری اکانومی کو، یہی ان کا ماڈل ہے پوری دنیا میں۔ لیکن آج ہمیں صبر کے ساتھ ہمیں اس کو ایکسیپٹ کرنا ہے، اس وقت کے لیے کہ آپ مل کر ہم سب محنت کر کے اصرار اور قربانی کے ساتھ پاکستان کو خوشحالی کی طرف ہم لے جائیں۔ اور یہ انشاءاللہ ناممکن نہیں ہے، ممکن ہے، لیکن اپنا مشکل ضرور ہے۔ دنیا میں کوئی بھی چیلنج ہوتا ہے اس کے ساتھ اپرچونٹی ہوتی ہے۔ تو میں آپ کو بتا یہ رہا تھا کہ پھر اللہ تعالیٰ نے کیا، فائنانس منسٹر نے دن رات محنت کی، ان کی ٹیم نے کئی دن، ہمارے جو سفارتی سطح پر ہمارے جو فارن منسٹر ہیں انہوں نے بڑی کاوشیں کی۔ کل جو $2 ارب جو آیا ہے، یہ خالصتاً، یہ میں آپ کو بالکل یہ بات دیکھیں، ہم اگر بات کو لاکھ چھپائیں گے تو چھپتی نہیں ہے۔ سچ جو ہوتا ہے وہ 100 سال بعد بھی سامنے اود کر آتا ہے۔ جھوٹ بھی اس طرح نہیں چھپ سکتا، وہ بھی کبھی اپنا آپ بہت کوئی سینسٹیو بات ہو تو کانوں میں بات کریں گے، لیکن پتہ ہر ایک کو ہوتا ہے کہ معاملہ اصل ہے کیا، حقیقت کیا ہے بالکل۔ تو میں آپ کو یہ بتا رہا ہوں کہ $2 ارب جو آیا ہے، یہ خالصتاً یہ ہماری جو نئے آرمی چیف ہیں جنرل عاصم منیر، ان کی خالصتاً ان کی کاوشوں سے آیا ہے کل، اور $2 ارب جمع ہوا ہے۔ کہنا یہ چاہتا ہوں، جہاں پر میں ملا ہوں MD IMF کو پیرس میں، بڑی ہم نے محنت کی، سیاسی محاذ پر بے پناہ محنت کی، میں نے بتایا آپ کو۔ لیکن اگر میں یہ کہوں جناب میں نے وہ بھی تیر مارا تو آپ کہیں گے یہ کیا ہمیں رام کہانی سنا رہا ہے۔ یہ قوم تبھی آگے چل سکتی ہے, آگے بڑھ سکتی ہے with unity of thought and action. اپنے اپنے دائرے میں رہ کر اگر ہم محنت کریں گے اور آگے بڑھیں گے تو بخدا یہ پاکستان چند سالوں میں آپ اپنی محنت سے اس کو آپ وہاں پر پہنچا دیں گے جہاں پر پہنچنے کا اس کا حق ہے. آج صبح میں نے ایک تعلیمی سیمینار میں نے یہ بات کہی تھی کہ مڈل ایسٹ میں وہاں پر اللہ نے ان کو تیل دیا ہے اور اللہ کا شکر ہے ہمارے وہ برادر ممالک ہیں. ہمیں اللہ تعالیٰ نے آپ جیسے ذہن دیے ہیں, آپ جیسے کاروباری لوگ دیے ہیں جو کہ دن رات کام کرتے ہیں, محنت کرتے ہیں اور ملک کے لیے آپ اربوں ڈالر کماتے ہیں. زمین ہے زراعت کے لیے, معدنیات ہیں جہاں پر اربوں نہیں کھربوں ڈالر جہاں پر وہ دفن ہے. آئی ٹی ہماری ٹیکنالوجی جو ہے آپ جانتے ہیں, وی ہیو اے یوتھ بلج. ہماری جو نوجوان جو پود ہے وہ 60% یہ پاکستان کی آبادی کا, ان کو ہم ہنر سکھائیں, انفارمیشن ٹیکنالوجی, ووکیشنل ٹریننگ سکلز دیں اور پھر ان کو ہم باہر بھجوائیں. یہ ملک جو ہے یہ ہمارا جو اللہ تعالیٰ کے فضل و کرم سے یہ ایک نیا ایک افق پر ایک نیا ملک بن کے آئے گا, لیکن باتوں سے نہیں, عمل سے اور محنت سے. میں صرف زیادہ آئی ایم ناٹ ہیئر ٹو ڈیلیور اے سرمن اور اے لیکچر. میں صرف آپ کی خدمت میں یہ کہہ رہا ہوں کہ آپ ہمارے بہت ہی محترم آپ سرمایہ کار ہماری کمیونٹی بیٹھی ہے فارما سے. میری آپ سے گزارش ہے کہ غریب آدمی کا آپ خیال رکھیں, اس کی دوائی کا. حکومت جو ہے وہ انشاءاللہ آپ کے تمام جائز مطالبات ماننے کے لیے میں حاضر ہوں. اور آج ہی میں کمیٹی جو کانسٹیٹیوٹ کر دیتا ہوں جو انہوں نے بتایا ہے. 2 ہفتے کا ہم ٹائم رکھتے ہیں, آپ بھی کوشش کریں, ہم بھی کوشش کریں گے 2 ہفتے میں ان مطالبات کو ہم منظور کر کے جو جائز ہیں ہم آگے بڑھیں اور پاکستان کو آگے بڑھائیں. میں آپ کا بہت شکر گزار ہوں, آپ نے یہاں پر مجھے دعوت دی. اللہ تعالیٰ آپ کو اور ترقی دے اور پاکستان کو آباد رکھے. آپ کا بہت بہت شکریہ.
Thank you so much, Prime Minister, for sharing your thoughts, insights, understanding concerns, and showing your support for this amazing industry here. We're truly grateful for this. Next, we'd like to honor some people in this room who've done some amazing things. And our first award is a Lifetime Achievement Award. And it's the Lifetime Achievement Award to honor excellence in pharmaceutical manufacturing and philanthropy. And it goes to Sardar Mohammed Yassin Malik, Group Chairman of Hilton Pharma. And I would like Harun to read a citation.
Bismillahirrahmanirrahim. Just 1 second. Thank you, Emma. Before I request my fatherly-like figure, Sardar Yassin Malik, it's my duty and my honor to present citation, Your Honorable Chief Guest. The Chairman and the members of the Central Executive Committee of the Pakistan Pharmaceutical Manufacturers Association extend their heartfelt congratulations to the Chairman, Hilton Pharma, Sardar Yassin Malik, on receiving the prestigious PPMA Lifetime Achievement Award. This esteemed accolade recognizes Sardar Yassin Malik Saab for his exceptional contributions to the pharmaceutical manufacturing and philanthropy. As the former chairman, PPMA, and the chairman of Hilton Pharma, Sardar Yassin Malik has made significant strides in advancing the growth and the development of pharmaceutical sector in Pakistan. His visionary leadership, unwavering commitment to the excellence, and notable achievements have earned him esteemed accolades such as Tamgha Imtiaz, Hilal Imtiaz, Sitare Imtiaz, and the Presidential Award bestowed by the Government of Pakistan. Sardar Yassin Malik's philanthropic endeavors have made a profound impact on the healthcare. His contribution to the Indus Hospital, to Jinnah Hospital, and many, many other institutions like this exemplify his unwavering commitment to improving the healthcare services and addressing the critical healthcare needs. On this occasion, the PPMA is proud to present the PPMA Lifetime Achievement Award to Sardar Yassin Malik Saab, Group Chairman, Hilton Pharma. This prestigious award recognizes his exemplary career, outstanding achievements, an invaluable contribution to the pharmaceutical industry, philanthropy, and society at large. I request Sardar Yasin Malik to please come to the stage and receive his award from our honorable chief guest, His Excellency, Prime Minister of Pakistan, Shehbaz Sharif. तालियां तो बजा दें प्लीज। Your Excellency, taking your time here, we have some awards to give out, and I request Emma to continue.
Thank you so much, Haroon, and congratulations to Sara once again. Fantastic. Up next, we have the Pharma Export Awards that we will be giving away, and we will get through these as quickly as possible. We've got lots of people to get through. First up, we'd like to welcome representatives for ATCO Laboratories. And then if we could please have Hilton Pharma coming up to the stage. MediSure Laboratories. These are our platinum partners. Without these people, this event would not be happening. That's okay, fantastic. So MediSure Laboratories. Oh, they're there? Okay, fantastic. Next, our gold partners at Genix Pharma. And also HiQ Pharma. And next memento goes to High Noon Laboratories. And our next awardee is CCL. And also OBS Pakistan. Our next gold partner to receive a memento is Martin Dow. like to invite up representatives from the Cell Company next. And up next is Farm Evo. Thank you so much to our gold partners. Up next, we'd like to recognize our silver partners, starting with Bosch Pharma. And next, we'd also like to welcome up Herbion. And I'd also like to welcome up Nabi Qasim Industries. And next, Sante, please. Next, representatives from Shazoo Pharma. And the last of our silver partners, Tabros Pharma. Thank you so much to all our partners without whom this event would not take place, and of course, the organizer and lead partner, TerraBiz. Thank you so much to all our partners. And now, to round us off, we would like to give mementos to our specially invited dignitaries. And if I could ask Syed Farouk Bukhari to hand these out, please. First up, we'd like to offer a memento to Mr. Makhdoom Murtaza Mahmood, Federal Minister of Industries. And we'd also like to offer a memento to Dr. Musaddiq Malik, Minister of State and Minister of Energy. And of course, we'd like to offer a token of appreciation to His Excellency Mian Mohammed Shahbaz Sharif, Prime Minister of the Islamic Republic of Pakistan. We'd like to offer a token to His Excellency Mian Mohammed Shahbaz Sharif, Prime Minister of the Islamic Republic of Pakistan. Thank you so much once again for being here today. It's been an absolute privilege, and we offer you gratitude of thanks. Thank you so much.
I think we should all appreciate State Secretary's wonderful efforts, and her voice resembles with the former Prime Minister of New Zealand. A big hand.
5 minutes.
Ladies and gentlemen, we'll give you a few minutes to head outside and retrieve your mobile phones. Then if we can gather back here again, we do have some more awards to go through because we'd like to recognize lots of you here today. So we'll give you 5 minutes or 10 minutes to retrieve your mobiles, and then we'll love to see you back here for the PESA 2023.
अच्छा, बाहर मीडिया वॉल है, आप सब लोग जिनको अवार्ड्स मिले वो वहाँ पे जाके अपनी ज़रूर पिक्चर्स और मेमोरीज क्रिएट करें. But we request everyone to stay seated. If you want to bring back your mobile phone, because we understand that it's not easy to be separated from your cell phones for so long, so bring them back. We have an exciting ceremonies for remaining awards. So we'll resume the program in 5 minutes.
Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMB. Welcome to Genix Healthcare, the first state-of-the-art equipment and nutraceutical plant, powered by pharmaceutical CGMP.
Return to your seats so we can start giving out the rest of the awards for this afternoon, because we'd like to recognize the amazing people that we have here today. If you would like to come back and take your seats so we can start our awards ceremony for the PESA 2023 Pharma Export Summit and Awards. If you'd like to return to your seats so we can get underway shortly. Thank you.
Chairman PPMA, Farooq Bukhari Saab, Conference Co-Chairman Harun Saab, former Chairman Zahid Said Saab, you are please all requested to take the seats, because unless you are seated, others will not. Farooq Bukhari Saab, kindly join us on the stage. Honorable Minister of State for Energy, Dr. Musaddiq Malik is already on stage. Harun Qasim Saab, Zubair Motiwala Saab, Chief Executive TDAP. Sir, kindly join us on the stage. Dr. Asim, Chief Executive DRAP. Sir, kindly join us on the stage. All the remaining 40 award recipients, you please kindly join us in the hall so that the ceremony can resume. Faisal and Terabi's executives who are outside, please make sure that everyone is back in the main hall in 2 minutes, or less than 2 minutes rather. Asad Shuja Saab and Zaid Saab, please also join us on stage. Dr. Kaisar Waheed, if you are hearing me, please come up on stage. Harun Saab, aap bhi aa jayein as a conference co-chairman. About to resume. आपने कहा हुआ तो है. एक दफा स्टार्ट हो जाए तो मैं देखता हूँ. Tala, can you please immediately locate the Master of Ceremonies, Emma? Yeah, Emma is here. Thank you.
So good afternoon, ladies and gentlemen, and welcome back to the Pharma Export and Summit Awards 2023. Pleasure to have you here, and we've got lots of awards to get through this afternoon, so let's get started with that. And I would like to please request and invite up Senator Dr. Musaddiq Malik, Minister of State and Minister of Energy, to please come up and give a short speech and also help us with the awards.
Thank you very much. And I think since most of the people present here are from Pakistan, I take the liberty of speaking in Urdu so that, you know, not only do we talk to each other and it becomes a dialogue, but it also reaches out to far beyond the hall of this hotel. देखिए, मैं बड़ी मुख्तसर सी बात आपसे करना चाहता हूँ. اور بنیادی طور پہ اس کے اندر 2 یا 3 بڑے عوامل ہیں. پہلی بات تو یہ ہے کہ یہ جو فارمیسی کی دنیا ہے یہ شروع ہوئی حکیموں سے اور اس طرح کے لوگوں سے, جہاں پہ میڈیسن جو فراہم کی جاتی تھی وہ بڑی پرسنلائزڈ میڈیسن تھی. یعنی ہر شخص کو ٹٹول کے, جانچ کے, اس کے مطابق کوئی صفوف بنایا جاتا تھا جس سے اس کو اللہ صحت دیتے تھے. اس کے بعد جیسے جیسے سائنس کا ارتقاء ہوتا گیا ہم میس میڈیسن کی طرف آتے گئے اور میس انٹرونشنز کی طرف آئے, جس کے نتیجے میں آپ کی انڈسٹری یعنی فارما انڈسٹری جو ہے وہ وجود میں آئی. لیکن حقیقت یہ ہے کہ فرام personalized medicine to mass medicine, we are now going back to personalized medicine. اور یہ حقیقت اگر آپ جان لیں گے اور اپنے آپ کو اس حقیقت کے لیے تیار کر لیں گے تو آنے والے وقت میں لوکل انڈسٹری میں بھی آپ کا مقام ہوگا اور آنے والے وقت میں بین الاقوامی سطح پہ آپ ایکسپورٹ بھی کر پائیں گے. ورنہ اس وقت جو پاکستان کا لینڈسکیپ ہے فارماسیوٹیکلز کا, میں اس وجہ سے تھوڑا بے تکلفی میں بولتا ہوں کہ بہت سے تو آپ میرے دوست ہیں, کوئی فارمیسی اسکول کے, کوئی میرے دوست ہیں, کوئی میرے سے سینئر ہیں, کوئی اب میرے میاں صاحب تشریف لا رہے ہیں, دوست ہیں صاحب. اس وجہ سے میں تھوڑا بے تکلفی میں یہ بات کروں گا تاکہ کچھ کنٹریبیوشن بھی کر سکوں. ایسی کوئی سیاسی تقریر نہیں 2 گھڑی کی کر کے چلا جاؤں. تو اس وقت جو کاروبار پاکستان میں چل رہا ہے اس کے لیے تو کوئی بین الاقوامی سطح پہ جگہ نہیں ہے. تو یہ ختم ہو جائے گا اور آپ کا بھی کاروبار ختم ہو جائے گا. اور نیا کاروبار جس میں پرسنلائزڈ میڈیسن ہے, جب وہ آئے گا وقت جس میں سیل تھیراپی یا جین تھیراپی یا ریجنریٹیو میڈیسن کرنی پڑے گی تو آپ اس کے لیے تیار نہیں ہوں گے. نہ آپ کے میڈیکل سکول تیار ہیں, نہ آپ کے فارمیسی سکول تیار ہیں اس کے لیے, اور نہ ہی فارماسیوٹیکل انڈسٹری تیار ہے اس کے لیے. اس وجہ سے مجھے لگتا ہے ایسے ہے کہ اس محاذ پہ جس تیزی سے ارتقاء ہو رہا ہے, ہماری نہ انڈسٹری, نہ ہماری تعلیم, نہ ہمارا انفراسٹرکچر اس کو کیٹر کر رہا ہے. تو مجھے آنے والے وقت میں کچھ بہت اچھے حالات اس انڈسٹری کے لیے نظر نہیں آتے. موجودہ حالات بھی تلخ ہیں لیکن مجھے کچھ اس میں ریسپائٹ نہیں نظر آتا. بات یہ ہے کہ دنیا جو ہے وہ یکسر تبدیل ہو رہی ہے اور اس کی تبدیلی کے پیچھے 4 بڑے عوامل ہیں. یعنی صرف آپ کی انڈسٹری کے لیے نہیں, کسی بھی انڈسٹری کے لیے 4 بڑے عوامل ہیں جس میں سے کچھ آپ کے لیے بہت زیادہ اہم ہیں. ایک ہے نینو ٹیکنالوجی کا, جس کے نتیجے میں لائف اور ڈیتھ کے جو کانسیپٹس ہیں وہ ری نیگوشیٹ پوری دنیا میں ہو رہے ہیں. اور بہت سے ممالک میں جو سائنٹیفک فرنٹیئرز ہیں وہ تو ڈیتھ کو یا ایجنگ کو ایک النس کی طرح ٹریٹ کر رہے ہیں. تو اینٹی ایجنگ جو ہے یا ریجنریٹیو میڈیسن جو ہے وہ ہر جگہ پہ عام ہے. تو یہ ایک بہت اہم پلیٹ فارم ہے جس میں آپ کو مہارت پیدا کرنی ہوگی. دوسرا جو اہم پلیٹ فارم ہے وہ نینو ٹیکنالوجی کا ہے, کیونکہ ہر چیز تو منیچرائز ہو رہی ہے. پہلے تو آپ کاٹ چھانٹ کے چیزیں کیا کرتے تھے, لیکن اب تو آپ ایٹمز اپ چیزوں کو ریکنسٹرکٹ کریں گے. اور آنے والے وقت میں جو میڈیسن بھی ہوگی اگر وہ پرسنلائزڈ ہو گئی تو پھر آپ دیکھیں گے کہ 3D پرنٹنگ کے ذریعے, یعنی اس وقت جو آپ فارماسیوٹیکل انڈسٹری میں جو کام کر رہے ہیں وہ 3D پرنٹنگ کے ذریعے ہونا شروع ہو جائے گا. اور اگر بہت زیادہ پرسنلائزڈ ہو گیا اور منیچرائز ہو گیا جو ہو رہا ہے, تو آپ کے سرہانے وہ مشین پڑی ہوگی جو آپ کی یعنی بلڈ شوگر لیول کی مطابقت سے یا بلڈ پریشر کے مطابقت سے یا آپ کی دل کی نالیاں کتنی صاف ہیں ان کی مطابقت سے ایک پرسنلائزڈ پرنٹ کرے گی, ٹائٹریٹڈ میڈیسن پرنٹ کرے گی آپ کے لیے اس دن کی جو آپ کی صورتحال ہے اس کو مد نظر رکھتے ہوئے. تیسری جو اہم چیز ہے وہ کوگنیٹو ٹیکنالوجی ہے, جس کے پیچھے یہ آرٹیفیشل انٹیلیجنس بھی ہے اور بہت سے فرنٹیئرز یا تو امیون سائنسز کے اندر اس وقت ایکسپلوریشن کے بے انتہا چانسز ہیں اور یا کوگنیٹو سائنسز کے اندر بے انتہا ارتقاء کے چانسز ہیں. اور وہ جو کوگنیٹو ٹیکنالوجیز ہیں جس کو بعض لوگ کوگنوس بھی کہتے ہیں, اگر اس میں جو ریولوشنز برو کر رہے ہیں اس کی تیاری بہت زیادہ ضروری ہے اگر آپ کو آگے بڑھنا ہے. سر ذرا 1 منٹ اگر اجازت دیں تو. اور فائنلی یہ تمام چیزوں کو جو چیز جوڑے گی وہ انفارمیشن ٹیکنالوجی کا ریولوشن ہے. تو میں آپ سے کہہ ہی رہا ہوں کہ the future is going to be at the intersection of 4 platforms: nanotechnology, biotechnology, cognitive technologies, and information technologies. And whatever solution we come up with, it's not going to be within the domain of one of these scientific platforms. The solutions are going to be at the intersection of these platforms. So these sciences are going to converge, and then these sciences are going to miniaturize, and then these sciences are going to construct medicine and all of the interventions, molecule up or atoms up, depending upon what you're constructing. And they would be intertwined with your lifestyles in real time through information technology, and that's where the solutions are going to be. اور آپ کو اس وقت تو یہ لگ رہا ہے ایسے جیسے کوئی راکٹ سائنس ہے یا مارس کے اوپر آپ روور چلانے کی باتیں کر رہے ہیں، مگر ان میں سے کوئی بھی ایسی چیز نہیں ہے جو اس وقت جہاں پہ سائنٹیفک فرنٹیئرز ہیں وہاں پر نہیں ہو رہی. ایک بھی چیز نہیں ہے. میں جن چیزوں کا آپ سے ذکر کر رہا ہوں، چاہے وہ سیلولر تھیراپی ہو، جین تھیراپی ہو، اینٹی سینس ہو، مونوکلونل اینٹی باڈیز تو خیر اب پرانی ہو گئی ہیں، یا سیل سرفیس ریسیپٹرز، یہ تو پرانی باتیں ہیں جو اب تک یہاں نہیں پہنچ پائیں. تو اگر آپ اس کے لیے تیار نہیں ہوں گے تو آپ کو نقصان ہوگا، اس انڈسٹری کو بہت زیادہ نقصان ہوگا. اور مجھے لگتا ہے کہ بہت تھوڑے عرصے میں یہ نقصان بہت ریمارکبل طریقے سے ہونے والا ہے. اس بات کو چھوڑ دیتے ہیں، یہ ذرا تھوڑی سی فیوچرسٹک بات ہے. تھوڑی سی فیوچرسٹک بات میں کسے کہہ رہا ہوں؟ میں تقریباً 15 سے 20 سال کو کہہ رہا ہوں تھوڑی سی فیوچرسٹک بات. اب ذرا میڈیم ٹرم میں آ جاتے ہیں. دنیا کے اندر جتنی بھی فارماسیوٹیکل ریولوشن آ رہا ہے وہ سب لارج مالیکیول میں آ رہا ہے. یعنی اب ریولوشن کیمیکل نہیں ہے، اب ریولوشن جو ہے وہ فارماسیوٹیکل سائنسز کا بایولوجیکل ہے. اور ہماری ساری مہارت جو ہے وہ کیمسٹری میں ہے اور کیمیکل ریولوشن میں ہے. ہمارے ہاں بیشتر جو میڈیسنز ہیں یا جتنا بھی کام ہو رہا ہے وہ اسمال مالیکیول میں ہو رہا ہے. اینڈ اسمال مالیکیولز آر ڈائنگ اکراس دا ورلڈ، بوتھ پرائمرلی ان دا R&D پائپ لائنز. اگر آپ جا کے پوری دنیا کی بین الاقوامی سطح پہ R&D دیکھیں تو آپ کو نظر آئے گا کہ بیشتر تھیراپیوٹک ایریاز جو ہیں دے ڈومینیٹڈ بائی لارج مالیکیولز. جب آپ پاکستان میں پریزنس دیکھیں تو آپ کو وہ جو پوری دنیا میں ہو چکا ہے وہ پاکستان میں اس کی آپ کو مینیفیسٹیشن نظر نہیں آ رہی. اس کے 2 نتائج ہوں گے. مثلا جس کو آپ جینیرک کہتے ہیں اس کو ہم بایولوجیکل، اس میں لارج مالیکیولز میں بایو سملرز کہتے ہیں. تو مجھے لگتا ہے کہ جو گولی ٹکی ہم پہلے بنا رہے تھے اسی طرح کی بایولوجکس کی ہم گولی ٹکی بنانا شروع کر دیں گے. مگر وہ جو ہمیں فرمنٹیشن چاہیے، جو ہمیں ایکسپریشن سسٹمز چاہیے جس میں مختلف بایولوجکس ایکسپریس ہو سکیں، اگر آپ نے ایکسپورٹ کرنی ہے، اگر آپ نے گلوبلی اپنے آپ کو کمپیٹیٹیو کرنا ہے، تو میں نے تو ایسی کوئی چیز نہیں دیکھی ہے. ضرور ہوگی کہیں نہ کہیں، کسی نہ کسی کمپنی میں ہوگی. اور ہمارے یہ بیٹھے ہوئے ہیں لیڈران، ہمارے ریگولیٹر بھی بیٹھے ہوئے ہیں، انہیں معلوم ہوگا. میری نظر سے نہیں گزری. اس کا مطلب نہیں کہ نہیں ہے، اس کا مطلب صرف یہ کہ میری نظر سے نہیں گزری. اور اگر یہ ہو کہ وہ نہیں ہے تو پھر آپ کو بہت الارم ہونا چاہیے، کیونکہ جو آپ ایکسپورٹ کی بات کر رہے ہیں وہ ایسے ہی ایک فینٹم سائنس ہے، صرف اس کا پھر حقیقت سے کوئی تعلق نہیں ہے. تو میڈیم ٹرم میں آپ کو کہوں گا کہ آپ کو بایولوجکس کی طرف جانا پڑے گا. آپ کو وہ چیزیں جو ہو چکی ہیں دنیا میں، چاہے وہ انٹرلیوکنس ہوں، چاہے وہ میبس ہوں، چاہے وہ سیل سرفیس ریسیپٹرز ہوں، بایو سملرز کی ایکسپریشن سسٹمز ہوں، اگر آپ ان سب چیزوں کو نہیں کریں گے تو یہ جو کیمسٹری کے ذریعے آپ مالیکیولز گولی کی شکل میں چھاپ رہے ہیں، آپ ان کی دنیا میں، پاکستان میں بھی مارکیٹ نہیں رہے گی. ہمارے بچے جس طرح پہلے ہوتا تھا کہ پوری دنیا میں ایوریج ایج اگر 60 ہے تو ہمارے ہاں 30-35 تھی، لوگ مر جاتے ہیں. تو اب ہمارے ہاں 50-60 ہے، تو دنیا جب 120 پہ پہنچے گی تو ہم 50-60 پہ گھوم رہے ہوں گے، کیونکہ ہمارے پاس تو ایکسیس ہی نہیں ہوگا، نہ ان مالیکیولز کا، نہ ان ٹیکنالوجیز کا، نہ ان انٹرونشنز کا، نہ اس طرح کا ہیلتھ کیئر سسٹم ہوگا. تو آپ لوگوں کو حکومت کے ساتھ مل کے، میرا یہ محکمہ نہیں ہے لیکن میرے خیال میں آپ کو حکومت کے ساتھ بیٹھ کے ان باتوں پہ غور کرنا چاہیے. یہ جو شارٹ ٹرم بریدنگ سپیس آپ کو چاہیے پرائسنگ کے ذریعے اور ان چیزوں کے ذریعے، وہ تو ہے، اس کا تو آپ کو حق ہے، وہ آپ کو ہونی چاہیے. مگر جو اصل مسائل ہیں میرا خیال تھا کہ آپ اتنی بڑی گیدرنگ میں مجھے شاید وہ ٹریڈیشنل بات نہیں کرنی چاہیے، کلیشیڈ کہ تھوڑی سی ٹیکس گھٹا دیں، تھوڑی سی یہ کر دیں، تھوڑی سی پرائس بڑھا دیں. آپ بڑھا بھی لیں گے تو کچھ نہیں کر پائیں گے. میں ابھی آپ کے سامنے مقدمہ پیش کروں گا کہ وہ کیوں ضروری ہے اور اس کے ذریعے آپ کیوں یہ کر پائیں گے، لیکن مجھے تھوڑی سی سیلف کانٹرڈکٹری بات، جسٹ ہیومر می ود دس سیلف کانٹرڈکٹری کانورسیشن. تو میں تھوڑی سی، کیونکہ آپ نے ٹاپک رکھا ہے ایکسپورٹس کا، تو ایکسپورٹس کے حوالے سے بات کر لیتا ہوں. لیکن جو ایکسپورٹس کے حوالے سے میں بات کرنے لگا ہوں وہ بہت شارٹ ٹو میڈیم ٹرم ہے، کیونکہ وہ ٹیکٹیکل ہے. وہ جو میں نے پہلے آپ سے باتیں کر دی ہیں، وہ اگر آپ اس انڈسٹری میں دیکھتے ہیں کہ آپ کی اگلی 2 نسلیں اس انڈسٹری میں رہیں گی تو آپ کو ان باتوں کے متعلق سوچنا چاہیے. لیکن اگر آپ 10-50 سال 20 سال کام کرنا چاہتے ہیں تو جو میری سمجھ میں ہے وہ مقدمہ میں آپ کے سامنے رکھ دیتا ہوں. دیکھیے بات یہ ہے کہ جو آپ کر رہے ہیں اس کے ذریعے آپ بہت زیادہ ایکسپورٹ نہیں بڑھا پائیں گے، کیونکہ یہ بات ٹھیک ہے کہ آپ کی مینوفیکچرنگ بہت زیادہ سوفسٹیکیٹڈ ہے اور اس کا کوئی مقابلہ نہیں ہے بسکٹ کی فیکٹری سے یا ٹافی بنانے کی فیکٹری سے. مگر کام اگر آپ ایمانداری سے سوچیں تو تقریباً وہی کر رہے ہیں. ہم باہر سے انگریڈینٹس منگواتے ہیں، یہاں پہ گولی ٹکی بناتے ہیں اور اس کے بعد اس کو بیچ دیتے ہیں. دنیا کچھ آپ کے اس کام میں بہت زیادہ انٹرسٹڈ نہیں ہے، اور بڑا مشکل ہے کہ آپ بین الاقوامی سطح پہ کوئی بڑا مقام پیدا کر سکیں گے تھوڑی سی زیادہ سستی گولی ٹکی بنانے سے. اس سے کوئی آپ کا کام میرے خیال میں چلے گا نہیں. تو جس انوویشن کی آپ کو ضرورت ہے وہ انوویشن تو یہاں سے ناپید ہو چکی ہے. اس وقت جو بہت سے لوگ پاکستان میں کامیاب ہیں، بہت سی کمپنیاں کامیاب ہیں، اس کی وجہ یہ ہے کہ پاکستان میں 1960 کی دہائی میں تقریباً تمام ملٹی نیشنلز پاکستان میں موجود تھیں. اسمتھ کلائن بیچم ہوا کرتی تھی، فائزر ہوتی تھی، اب تو بے شمار کمپنیاں، سینڈوز تھی، سب ختم ہو گئیں، نوارٹس بن گئی اور وغیرہ وغیرہ. یہ نئی کمپنیاں آ گئیں اس زمانے میں. ہر تقریباً کمپنی ابھی بھی آپ کو لائسنسز کی شکل میں وہ پرانے نام، سرل تھی، وہ آپ کو نظر آتی ہیں کیونکہ آپ کے پاس پرانے لائسنسز ہیں ان لیگوں چیزوں کے. مگر آپ کو یہ معلوم ہے کہ وہ تمام کمپنیاں یہاں سے جا چکی ہیں اور جو نہیں گئیں وہ جانے کا تقریباً پروگرام بنائے بیٹھی. تو سوال یہ پیدا ہوتا ہے کہ 1960 سے لے کے 1970-80 تک تو جو آپ نے جو مہارت پیدا کی، آپ کے لوگوں نے مہارت پیدا کی، آپ نے ٹیکنالوجیز پیدا کی، آپ نے سیکھا کہ کیسے بائیو ایکویولنس کرتے ہیں، کیسے اسٹیبلٹی ٹیسٹ کرتے ہیں وغیرہ وغیرہ. وہ تو آپ نے سب سیکھ لیا، جس کے نتیجے میں آج تک ہماری لوکل انڈسٹری چل رہی ہے. مگر جو اب وہاں پر ہو رہا ہے اس کی تو یہاں پہ ڈیفیوژن آف ٹیکنالوجی نہیں ہو رہی، نہ ڈیفیوژن آف ٹیکنالوجی ہو رہی ہے، نہ ڈیفیوژن آف انوویشن ہو رہی ہے. تو اگر آپ آج سے 10-15 سال آگے چلے جائیں تو میں سوال آپ کے پاس سامنے رکھوں گا. ایک تو وہ لوگ جو اس وقت کے ٹرینڈ ہیں وہ ہماری عمر کو پہنچ چکے ہیں، بے شمار تو ہوں گے ہی نہیں آنے والے وقت میں، اور جو ہوں گے بھی انہیں وہی پتہ ہوگا جو ہماری طرح کے آپ کی طرح کے لوگوں نے ان کو سکھایا ہوا ہے، مگر جو ہم نے بھی نہیں سیکھا، کیونکہ وہ سب آیا 2000 کے بعد، 2010 کے بعد. وہ ڈیفیوژن اس معاشرے میں آپ کے بچوں میں آنے والے وقت میں آپ کی ٹیکنالوجی آپ کے اداروں میں کیسے ہوگی، میں یہ بات سمجھنے سے قاصر ہوں. اس کا مطلب ہے سب سے زیادہ امپورٹنٹ چیز جو ہے وہ پاکستان میں انویسٹمنٹ ہے، کیونکہ انویسٹمنٹ صرف ڈالر نہیں ہوتے. مجھے تو انویسٹمنٹ میں سب سے غیر اہم چیز جو ہے وہ ڈالر دکھتی ہے. انویسٹمنٹ کے ساتھ ٹیکنالوجی آتی ہے، انویسٹمنٹ کے ساتھ انوویشن آتی ہے، انویسٹمنٹ کے ساتھ ٹیسٹ نالج سسٹمز آتے ہیں، نئے بزنس ماڈلز آتے ہیں جن کا جو آپ کے گمان میں نہیں. آپ امریکہ کی اگر دیکھیں مارکیٹنگ ٹیم اور وہ دیکھیں کہ ان کی جو کمرشل ٹیمز جو ہیں یا مارکیٹ ایکسس ٹیمز جو ہیں یا ان کی جو آؤٹ کمز ریسرچ ٹیمز جو ہیں یا اب بگ ڈیٹا ٹیمز جو ہیں وہ کیا سوچ رہی ہیں، وہ کیسے پینیٹریٹ کر رہی ہیں، وہ کیا انشورنس سسٹمز ہیں، وہ کیسے پیشنٹ کو سیگمنٹ کر رہی ہیں، کیا لاجک ایویڈنس کس چیز کا اکٹھا کر رہی ہیں، اس ایویڈنس کو کیسے استعمال کر رہی ہیں. تو آپ بولیں گے یہ ہم کیا کر رہے ہیں، اور اس کا کیا تعلق ہے دنیا کی فارماسیوٹیکل انڈسٹری سے. یعنی مہارت صرف ٹیکنالوجی کی نہیں ہے، مہارت ٹیسٹ نالج سسٹمز کی ہے، بزنس ماڈل کی ہے، پروڈکٹ لانچ کے طریقہ کار کی ہے. مختلف سیگمنٹس میں پینیٹریشن کرنے کی ہے, صرف ڈسکاؤنٹس کی اور پرائسنگ کی نہیں ہے. تو وہ انگریزی میں کہتے ہیں کہ یو آسک اے رانگ کویسچن, odds are very high that you're going to get a wrong answer. And I'm afraid I feel that we are all asking the wrong question. And the likelihood of getting an extremely wrong answer is very high. And if we ever get the right answer, it would just be an accident. Because the structure of our logic is not right. تو یہ میں نے کہا کہ انویسٹمنٹ, اب میں ذرا وہ کانٹراڈکٹری بات کیے دیتا ہوں. کانٹراڈکٹری بات یہ ہے صاحب کہ اگر آپ کی سوفسٹیکیشن آف ڈیمانڈ فنکشن نہیں ہوگی تو آپ کے ساتھ کوئی انویسٹ نہیں کرے گا. اگر ہم یہ نہیں سوچ پائیں گے کہ انوویشن پہ ہم نے کیا پریمیم دینا ہے اور سائملٹینیسلی لائف سیونگ ڈرگس کے ذریعے غریبوں کو کیسے بچانا ہے, اگر یہ ڈیمارکیشن ہم نہیں کر پائیں گے تو پھر کوئی اس ڈیمانڈ فنکشن میں سوفسٹیکیشن نہیں ہے کہ جس کو مد نظر رکھ کے کوئی بھی شخص یہ فیصلہ کرے کہ میں پاکستان میں آ کے انویسٹ کروں گا. تو آپ اور ہم ہی رہ جائیں گے اور آپس میں مارکیٹ شیئر کے لیے تھوڑی بڑی لڑائی وڑائی کرتے رہیں گے جب تک ہمارا کمپلیٹ ڈیمائز نہیں ہو جائے گا, یا ہم irrelevant نہیں ہو جائیں گے, یا کیونکہ جتنے آپ سوفسٹیکیٹڈ ہوں گے اتنے ہی ہمارے علاج سوفسٹیکیٹڈ ہوں گے, تو دنیا کے لیے ہم irrelevant ہو جائیں گے. تو کنویں کے اندر تو جو مینڈک ہوں گے وہی انہی کی آواز سنائی دے گی. تو اس وجہ سے بہت زیادہ امپورٹنٹ ہے کہ ہم اپنی لوکل مارکیٹ کو سوفسٹیکیٹڈ بنائیں, ایک ڈیمارکیشن کریٹ کریں بٹوین دا لائف سیونگ ڈرگس, جنیرک ڈرگس. مجھے اشارہ ہو گیا کہ جلدی سے ریپ اپ کر دیں, میں تو فٹافٹ بولتا چلا جاتا ہوں. تو میں آپ کو بس ہیڈرز جو میرے ذہن میں وہ بتا دیتا ہوں تاکہ یہ ہم ریپ اپ کر سکیں. سو انلیس سوری جی آپ کی مرضی, میں تو مجھے انہوں نے کہا ہے, میں تو اپنی نوکری کر رہا ہوں, جو آپ کو ملے گا وہ آپ کر لیجیے گا. میں تو صرف یہ کہہ رہا ہوں کہ ہمارے ہاں مجھے یہ لگتا ہے کہ ہمیں یہاں پہ نئے سرے سے پرائسنگ رجیم کو سوچنا ہوگا پاکستان میں, تاکہ باہر رہنے والے لوگ جن کا پاکستان سے کوئی تعلق نہیں ہے ان کو ایک اپرچونٹی نظر آئے پاکستان میں. بالخصوص انوویٹیو انٹرونشنز جو ہیں, یہ ناول انٹرونشنز جو ہیں, ان کو مد نظر رکھتے ہوئے وہ یہاں پر آئیں گے تو بہت سی ایسی چیزیں لائیں گی جن کا ڈالر سے کوئی تعلق نہیں. اور آپ کی انڈسٹری میں دا لیسٹ امپورٹنٹ تھنگ از ڈالر, دا موسٹ امپورٹنٹ تھنگ از انوویشن اینڈ دین ٹیکنالوجی. وہ لے کر آئیں گے تو آپ کا فائدہ ہوگا. دوسری بات یہ ہے کہ میں آپ کو بین الاقوامی سطح کے اوپر بتا سکتا ہوں کہ کیسے لوگ ایکسپورٹ میں کامیاب ہوئے ہیں. باقی تو آپ مجھ سے بہت زیادہ جانتے ہیں, پاکستان میں $1 بلین کی آپ تقریباً ایکسپورٹ کرتے ہیں, میں تو تھیوریٹیکل باتیں کرتا ہوں صرف. دیکھیے, یا تو آپ کو کچھ فوکس کرنا پڑے گا. اس وقت بہت کم فوکس ہے بہت سی کمپنیوں میں بھی اور اوور آل انڈسٹری میں بھی. یا تو آپ کو فوکس کرنا پڑے گا پیشنٹ پہ, اور کیونکہ میس مارکیٹ کے اندر آپ کمپیٹ نہیں کر پائیں گے تو پروبیبلی آپ کو آفن مارکیٹس کے پیچھے جانا پڑے گا. آفن مارکیٹس وہ ہیں جہاں پہ پیشنٹس کے نمبر اتنے قلیل ہیں, اتنے چھوٹے ہیں کہ ان کو اسپیشل پروویژنز گلوبلی دی جاتی ہیں, اور اس وجہ سے ان کی پرائسنگ کے اندر بھی آپ کو تھوڑا سا ایڈوانٹیج ہوتا ہے. اگر آپ آرفن ڈرگس کی طرف فوکس کریں تو ہو سکتا ہے کہ آپ کو تھوڑی سی نیش مل جائے, کیونکہ وہ نیش ہرڈل ریٹ جو بڑی بڑی کمپنیاں فائزر ٹائپ یا گلیکسو ٹائپ ان یا ایون درمیانی اور چھوٹی کمپنیوں کی ہرڈل ریٹ کے نیچے ہے. تو آپ کو جو آرفن ڈرگز ہیں ان کے اندر بھی نیش ڈھونڈنی پڑے گی چھوٹی سی, جس میں آپ کوئی نہ کوئی اپنا مقام پیدا کر سکیں. دوسرا آپ کے پاس راستہ یہ ہے کہ آپ پیشنٹ سیگمنٹس پہ فوکس نہیں کریں, آپ ٹیکنالوجیز پہ فوکس کریں. اور یہ بہت سی دو ممالک جو دونوں ہی ہمارے بہت دشمن ہیں, ان کی بہت سی شاندار کمپنیاں جو ہیں وہ یہ کرتی رہی ہیں. وہ ان ٹیکنالوجیز ان کو وہ کہتے ہیں ٹیکنالوجیکلی آرفن ہے. مثلا آپ گولی کھاتے ہیں مگر اس کو پیچ میں تبدیل کرنا بہت مشکل ہے, اور جو مہارت چاہیے وہ ڈلیوری کی مہارت ہے. مثلا ویسٹ فارماسیوٹیکل ایک کمپنی ہے جو صرف یہی کام کرتی ہے کہ آپ وہ چیزیں جو ڈلیور نہیں ہو پاتی کنوینینٹ ڈلیوری میکنزمز کے ذریعے, آپ اس میں مہارت پیدا کر دیتے ہیں. وہ ایک آرفنڈ ٹیکنالوجی ہے, اور آپ کے جو لوگ ہیں ان میں مہارت یہ ہے کہ وہ ایک ریگولر مالیکیول کو ایک ایسی ایکسپریشن سسٹم, ایک ایسے ڈلیوری سسٹم میں ڈالتے ہیں جو کوئی اور نہیں ڈال سکتا, جس کے نتیجے میں آپ کا گلوبل فٹ پرنٹ بڑھتا چلا جاتا ہے. یہ دوسرا طریقہ کار ہے. تیسرا تو بڑا آبویس ہے کہ آپ تھیراپیوٹک ایریا پہ فوکس کر لیں. وہ تو بہت میں آپ لوگ کرتے ہیں, کسی کا آپتھمالوجی میں فوکس ہے, کسی کا کارڈیو ویسکولرز میں, کوئی سنڈروم ایکس کو ڈھونڈتا ہے, وہ آپ کی ہے. مگر وہ فوکس اچھا رہتا ہے. بین الاقوامی سطح پہ कोई भी कंपनी ऐसी नहीं जो हर काम करती हो, हर दवा बनाती हो। तो अगर आपके पास 100-50 दवाइयाँ हैं तो पूछिए अपने आप से कि आपने ये 100-50 क्यों रखी हुई हैं। उनमें से बेशुमार आपको छोड़ देनी चाहिए और फोकस करना चाहिए 2 या 3 थेरेप्यूटिक एरियाज़ पे जिसमें आप कुछ ना कुछ काम कर सकते हैं। और फाइनली ये है कि देखिए, दुनिया में कोई बायोटेक्नोलॉजी नहीं है बायोलॉजी के बगैर, कुछ नहीं है। सिर्फ बायोटेक्नोलॉजी विदाउट बायोलॉजी इज जस्ट एन आइडिया। Biology is biotechnology, just in the way physics is nanotechnology. तो जब तक आपके तालीमी मयार जो हैं उनमें कुछ इजाफा नहीं होगा, जब तक आपके जो फरसूदा अब हमारी मेडिकल स्कूल्स की रिकग्निशन भी एक मसले में आई खड़ी है अमेरिका में। फार्मेसी स्कूल्स में यहाँ पे हमारे वो हेनरी मनेसी जूनियर आए थे, प्रेसिडेंट भी होते थे आयोवा स्टेट यूनिवर्सिटी के, मेरी यूनिवर्सिटी में वो डीन हुआ करते थे कॉलेज ऑफ फार्मेसी के। तो उन्होंने कहा भाई टॉपिक तो तुम लोगों ने सब लिख रखे हैं मगर आउटकम्स जो हैं बड़ी पुअर है। यानी वैसे तो खाना सारे पुअर कर दिए हैं आप लोगों ने, लेकिन अगर आप देखें कि लर्निंग आउटकम्स क्या हैं तो आपके लोग तो हमारे यहाँ अब नहीं आ सकते, ये तो बात नहीं बनेगी। तो हमने धड़ाधड़ स्कूल खोलें, गली मोहल्ले में स्कूल खुले हुए हैं, टॉपिकल एरिया सारे लिखे हुए हैं, लोगों के नाम भी लिखे पड़े हैं, लेकिन लर्निंग आउटकम्स के हिसाब से बहुत बड़ी खलीज है जो बढ़ती चली जा रही है बिटवीन अस एंड द वेस्टर्न कंट्रीज़। तो आप अगर इस खलीज को पार नहीं करेंगे तो बाकी तमाम चीज़ें जो हैं ये सिर्फ एन आइडिया हैं, विच इज़ नॉट इवन वर्थ द पेपर ऑन विच दे आर रिटन। सो फाइनली, just to wrap up, I can go on. I'm purposefully not looking at you. I know you're doing this and I'm purposefully not looking at you. But let me wrap up by saying, there was a time when 68% of the world's market by revenues was just the United States and Japan. That's it. This was the 1990s. 68% of the value of pharmaceuticals of the world by revenue, by dollar, were two countries. That has changed. Now the most rapidly emerging areas are Latin America and the emerging markets. China is a great market. And many of the multinationals, because of what I am saying China has done, China has made a demarcation between the generic products, life-saving products, and innovative products. And the premium is only on innovative products and not on the generics at all. And therefore, China is of not very high interest to multinational corporations for those products which are going off patent or which are close to going off patent. That's a tremendous opportunity for you. If they are not interested, then there is a gap. There's similar gaps in Latin America. At some other time, when you give me more time, I've done this for many long years. I can sit with you and can give you my perspective. But suffice to say that the rapidly emerging markets, the rapid growth of spending as well as investments in emerging markets is an enormous opportunity for you. But you'll have to rethink about pharmaceutical sciences and pharmaceutical industry if you want to succeed and capitalize on it. Thank you very much, and sorry for going over.
Thank you so much. And now we're going to move on to our Exporter Awards. And we would ask Dr. Malik, along with Dr. Asim Rauf, CEO of DRAP for Industries of Pakistan, and also Mr. Zubair Matiwala, CEO of DTAP for Industries of Pakistan, to help give out these awards. And the list is long, so let's crack on, shall we? First up, we would like to recognize Saffron Pharma. Saffron, if you'd like to come up to the stage, please. Congratulations. And next up, we'd like to recognize Getz Pharma. And up next, we'd also like to ask Sammy Pharma to come up and receive their award. And next, could we please request Sanofi Avantis, Pakistan. Sanofi Avantis. Surge Laboratories is our next awardee. Surge Laboratories. BF Biosciences. Do we have representatives from BF Biosciences? And AGP Limited. Would you like to come up? And our next awardee is Star Laboratories. Yeah, he's coming, he's coming. And next, we'd like to invite a representative from MTI Medical to come and collect their award. Next, we'd like to recognize SciLife Pharma. Have anyone from SciLife Pharma? No. Pharmatic Pakistan. Pharmatic Pakistan. Do we have any representatives? Ferrosons Laboratories. Ferrosons Laboratories. And Brooks Pharma. Brooks Pharma, would you like to come up? All the way from the back. You guys are so quiet. Let's give our awardees a nice round of applause. This is good stuff. Thank you, Brooks Pharma, for being here. Also next, Biolabs. Do we have a representative from Biolabs? There we go. There we go, Biolabs. Next, we have Macta International. Macta International? No. Is that a yes or no? I couldn't decide. Zaffa Pharmaceutical Laboratories. Zaffa Pharmaceutical Laboratories, and also Medisure Laboratories, Pakistan. Medisure, do you have representatives? Yeah. Efros Chemical Industries. Do we have a representative from Efros? And then Phomedic Laboratories. Phomedic. He's coming. Yes, no? Can't tell. Selmore Pharma. Selmore Pharma, is that you guys at the back? And after Selmore, if we can have Remington Pharma. And then Pacific Pharma. Do you have a representative from Pacific Pharma? Sante. We did Sante already. No, sorry, Sante. Indus Pharma. Indus Pharma? You deciding who to send up? Okay. And then Medipack. And then Wilshire Laboratories. No. Davis Pharmaceuticals. Yep. If they get it. There we go. Excellent. Shigan Pharma. Shigan Pharma? Over there. Yep, they're here. And then Don Valley Pharmaceuticals. Don Valley. Don Valley, yeah. Uniferose. Uniferose? Then Nexus Pharma. Frontier Dextrose. No. English Pharma Industries. Swiss Pharma. Swiss Pharma? He's over the back. No? Yes, no. Oh, he's gone. No. Okay, fine. Pleva, Pakistan. Pleva. No. Renacon Pharma. Opal Laboratories. Then Otsuka, Pakistan. Focus and Rules Pharma. Winsfield Pharma. Valiant Pharma. Novamed Pharma. Then that's it. Thank you so much to all our exporter awardees. Let's give them a nice round of applause. And now we move on to our academic partners that we'd like to recognize today. Dow University of Health Sciences. Pack Austria Fachhochschule. Mein Deutsch ist nicht gut. The Institute of Applied Sciences and Technology. Ripa International University. And United Medical and Dental College. Thank you so much to all our academic partners helping us out with this event. Amazing stuff. Now we'd like to recognize our exhibitors. Green Pharmacy. And Pharma Asia. Thank you so much to our exhibitors. And finally, we'd like to recognize our PR partner, Publicity Channel. Thank you so much to all our awardees, and thank you, gentlemen. Just before we do our group photo here on the stage, I know Haroon would like to give a vote of thanks. Thank you so much for being here for this wonderful event, and I will hand over to you.
Thank you, Emma. Thank you, all the participants. On behalf of the organizing committee, on behalf of the PPMA, I would like to thank everyone, especially our ministers, and our supporters and our partners. Everyone present here, the audience, and thank you very much. Have a good day. The group photo, I think, is ready, if we can have. Everybody? Do we want everybody for group photo? As many as we can. Why not? And then we have tea at the closing.
Ladies and gentlemen, if you'd like to come forward for a group photo on the stage, let's have everyone. Why not? Let's do anyone that wants to be in a group photo, come be in a group photo. It's all good. Just don't spread out too much on the stage. All squeeze in, some on the stage, some on the steps, some on the floor in front. If we can put the tall people on the back. See, I'm short, so I'll just hide here. Everybody squeeze in. Anyone else want to join? There we go. Isn't that nice? Photographers, are you ready? Are you ready? Should we do it? 1, 2, 3, Pharma. 1, 2, 3, Pharma! Just me then. Thank you so much, ladies and gentlemen. Thank you for being here for the Pharma Export Summit and Awards, the PESA 2023. And we hope you've had some amazing takeaways, got some good insights, got some good information, and done a lot of networking while you've been here. My name is Emma. It's been an absolute pleasure to host the event for you. Have a wonderful evening, and please get home safely.